Hello, check, 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 check. Test, test.
Hello? Hello? Oh, yeah. I can hear. 3? 1, 2, 3?
It's over here.
1, 2, 3.
كيف ما بتسمعين؟ فيش سيجنال.
2, 3?
Yes, good. Test 1 2 3 4. Test 1 2 3 4. Test 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 test. فور تيست 1 2 3 4. شغلتها؟ حطها 3 وسجلها هنا. بسم الله الرحمن الرحيم. اوكي.
Listening to us. We're listening to ourselves.
Hello. Good morning. I hope everyone, I'm audible enough, and I hope the online participants can hear me. Um, Welcome to the networking session titled Codes and Constitution, Empowering African Parliamentarians. My name is Millennium Anthony. I am the coordinator from Youth IGF in Tanzania, but I'm also an ITU Generation Connect Youth Envoy, but also a founder of STEMHAR Network. And today I'm going to be a facilitator for this roundtable discussion today. So this session is designed to foster a meaningful dialogue between African parliamentarians, multi-stakeholder participants, and policy experts as we explore the intersection between code and constitution principles. Our goal is to share insights, highlight challenges, and identify opportunities to create a robust digital framework for Africa. So first of all, I'll just to give a highlight of the session overview, how we are going to conduct it. So first, we'll have introduction from our speakers here, and then we'll have the two speakers here will give just a brief presentation, a brief contribution on the topic that we're going to be discussing. And then after that, I'll open the floor to the participants, and then we can have different areas that we are going to be discussing. And then in the end, we're going to close by having a summary of key takeaways and next steps. So now I open the floor to my panelists here. If you are going to introduce yourself in the first round, and then I'll open the floor for you to contribute.
Thank you very much. Thank you very much. My name is Catherine Muma. I'm a senator from Kenya, nominated senator. And at the Senate, I am a member of the Speakers Panel. I am also a vice chair of the Devolution and Intergovernmental Relations Committee and the Justice, Legal and Human Rights Committee. But I also represent the Kenyan Senate on the Interparliamentary Union, and I'm a member of the Working Group on Science and Technology in the Interparliamentary Union Working Group. I am also a member of APNIG. APNIG is the African Parliamentary Network on Internet Governance, which is, I think I can speak about that a little later. But that is what I am, who I am. Thank you very much.
Thank you very much, Honorable.
Hi, my name is Honorable Khutsa Mafete, a member of Parliament from Lesotho, a member of APNIG as well, African Parliamentarians on Internet Governance Network. In my Parliament, I sit on a portfolio of Prime Minister's ministries, which hosts Ministry of ICT, Labor, Public Service, and others. Thank you.
Thank you very much. So I would now like to welcome the floor to you, Honorable Catherine. If you're going to tell us how is the current state of digital frameworks in Africa? What is the role that parliamentarians do in supporting the digital development and growth in Africa?
Thank you very much. Now, that's a good question, asking about how are the digital frameworks in Africa. Now, Africa is currently has laws that are guiding all sectors. But as you are aware, digital technology is a technology that is cross-cutting. It is going to be relevant in every sector, and it has evolved much faster than policy has evolved. And as it has evolved, we have national executives that are trying to do something about it, but parliaments, I think world over, not just in Africa, parliaments are lagging behind in the sense that as policies are made, as those who work in digital technology engage, they engage largely with the executive governments. and then the parliaments are now playing catch up. And the legislative process usually takes a lot of time. It means the government will bring in a law, and the legislative process will take time, sometimes a year, even more. Or a private member bill will come, will address a particular issue. So you will find that currently, because of the levels of competences of parliaments, which is low, and I believe this is world over, the competences of parliaments on digital technology concerns are low, and because of that, the legal frameworks on digital technology matters are limited in many countries. So if you look at Africa, there is a variation. You'll find that Tanzania will have different laws, Kenya will have different laws, Lesotho will have different laws, South Africa will have different laws. For instance, we have countries that have data protection laws, we have others that don't have any. We have countries that have access to information laws, others don't have any. So that is why when we started realizing the magnitude and the importance of actually engaging as parliaments on issues of policy, parliamentary policy, on digital technology, we formed the African Parliamentary Network on internet governance, precisely to share our views across board and to agree on the best way that we can actually share experiences, learn from each other. So APNIG is made of members from across Africa, East Africa, Southern Africa, Western Africa, North Africa, of members who are passionate about trying to do something about policy on internet governance. We have come together and we are now looking to do capacities for our members. We are now looking to developing what we are calling a model law, quote unquote. And a model law is just about getting in place standard minimums that we think would make sense for purposes of legislation around digital governance, but bearing in mind, legislation is across board. So we want to learn, we want to engage in forums like the IGF, ICANN, and any other, so that as parliamentarians we can have the capacities to be able to, from an informed point of view, contribute in our debates and be part of the solution in accelerating any law that would facilitate the proper facilitation of growth in internet, digital technology, where as well as provide the safeties, the securities that are required within the sector.
Thank you very much, Honorable, especially for highlighting organizations such as the APNIG, where we see that's a platform for parliamentarians to engage themselves in all these digital works. And coming to you, Honorable, what are the unique challenges that we currently have when it comes to shaping, in Africa especially, digital policies across the continent? Are there any challenges that we currently have in Africa?
Thank you. I think there's a lot of challenges. She's highlighted quite a few, but in my view is that for most of the laws that were expected to be put in place, most of them, they come in pre-modeled from Western countries, from wherever, as opposed to what Africa has been is supposed to be doing. So, like now we're talking about capacity buildings, we're talking about inclusivity, we're talking about redoing whatever the system that is been doing, more especially now that we're into AI or going into AI and digital policies. So my take is, what we need to do right now is we just need to, as much as we can do a literal freeze, but now we now need to start getting in all stakeholders in point, and Africa should be put on the forefront of whatever plannings that are there, as opposed to getting what is done and then I think basically that's my take on the challenge that we have. We get things that are already done, and now we cannot adopt to them because they're not modeled for what Africa is doing.
Okay. Thank you very much, Honorable. Okay, now since this is a networking session, I wanted it to be most engaging and interactive. And now I'll open this floor to the participants, both online and on site here. And we're going to have a discussion, and I would like to take contributions from each one of you. And our discussion is going to be on three main pillars. So the first pillar we're going to be discussing is on CORD as legislation, and then the second that we will take is collaboration and multi-stakeholder engagement, as Honorable has said, the importance of multi-stakeholder engagement. And then the last pillar that we're going to be discussing is on the Africa's unique challenges and opportunities. So now I'm going to start with the first pillar, which is CORD as legislation. And my question to you, my participants, is how can African parliamentarians effectively shape technology-driven legislation to ensure inclusivity and innovation? So if any of you is open and ready to contribute on this question, I can pass the mic to you.
I have the same question.
You have the same question. Yes, so if I don't have, now I can start maybe with my here, with my panelists, and then we can come back to you. Okay.
Thank you. I think that the answer to that question, in my view, lies in the question. She made reference to multi-sectoral or multi-stakeholder engagement. And my view is that this is the one area where, as a legislator, I cannot purport to know what is right and just prepare a bill and take it to Parliament. This is the one area where we need greater consultation among all affected stakeholders to define for ourselves what inclusion means. From the statistics that we were given in the opening plenary and from this forum, I think you will have realized that Africa has the least connectivity and also the most expensive. And so access is quite limited for Africa. So as parliaments, we need to start asking ourselves, one, what should the role of government be in facilitating greater access? And what can we do as parliaments in that role? Now, parliaments have the role of representation, of legislation, of oversight, and we also have authority over budgetary allocation. So I think if we define for ourselves what is digital public infrastructure and what role government can play in that, the parliaments can help to invest, to deploy more resources towards facilitating digital public infrastructure across the countries in order to have greater coverage. And we must deliberately start picking the data that will tell us who is unconnected, who is underconnected, whether it is women, whether it is senior citizens, whether it is those in the rural areas, whether it is the urban poor, and define solutions, but put budgetary allocations to ensure that we get that. My view is that if we facilitate as government the digital public infrastructure, then we leave the rest to the private sector and other stakeholders to actually move with it. But similarly, for us to do that policy, we need to understand from the stakeholders on the key needs. So as we make this legislation, we also need to find a way of not just moving as Parliament alone, as the executive alone. We need to find a way in which we can get the experts to contribute and guide us on what looks like good law, what is good regulation, what is bad regulation, so that we are able to facilitate. That's my view on that.
Thank you so much, Honorable. I mean, I think for me, I really like the point when you mentioned about data. I think for me, maybe taking, for example, in my country, I think that's really a serious issue. Like, there are some areas that we still do not know, like how, to what extent has the internet penetrated in specific areas. So even like when the government is trying to like to help those areas, they do not know like what specific area, how much resources do we need to invest in a specific area for us to, help in providing internet access. And wait, do we have any contributions now here? Can I have that? Yeah.
I have.
It's not on.
Yes, my name is Daniel Molokele, Member of Parliament from Zimbabwe, and a member of APNIC. Just to contribute one or two points, in terms of parliamentarians facilitating inclusivity, I think one of the easiest ways is to make sure that the legal and policy framework is updated to the level that it accommodates all those who are excluded, especially in terms of making it obligatory for the state to set up the necessary infrastructure to increase access especially to the internet. I have in mind our rural populations that are normally excluded. Internet access is a big issue for them. Also that there can be mobile internet facilities in some rural areas so that people can access the internet. Also that MPs can fight during the budget period to make sure that the budget allocation toward ICT is increased in such a way that it funds some of these issues that I've raised, especially around infrastructural support for those who are traditionally excluded from the internet, access to the internet. The other issue which is big in my country, in Zimbabwe, is the pricing of data. Data has traditionally been expensive, although I need to concede that Zimbabwe earlier this year gave a license to Starlink, and that has started to create a little bit of competition to the traditional internet service providers. But for the average citizen in Zimbabwe, especially those in local communities and also in rural areas, data remains very expensive. And we have to push for policy frameworks that force the pricing of data to come down, so that more average people, citizens, can have access to the internet. The other thing that we need to do is to increase or call for policies that force, especially the Ministry of Primary and Secondary Education, to create civil awareness and education around internet. You'll find that some people don't even know how to use some of these basic concepts. So around access to internet and digital technologies. So we need awareness, even also through the Ministry of Communications or the Ministry of Broadcasting Services or whatever. Thank you so much.
Wow, thank you so much, Honorable. Do we have any contribution here? Another contribution that someone would like to contribute before we move to our second pillar? Okay, so let me check with online. Do we have any online participant that want to contribute? Okay, I don't have any hand raised, so I guess we can move to the second pillar. So our second pillar is on collaboration and multi-stakeholder engagement. So we know collaboration is a very is the key to impactful digital policies. So now my question is, how can parliamentarians engage with technologists, civil societies, and private sectors to ensure policies are both practical and inclusive? So now maybe I can start from the audience. I can repeat the questions. How can parliamentarians engage with technologists, civil societies, and private sector stakeholders to ensure policies are both practical and inclusive? Yes, Honorable.
Thank you. I think in that my simple thought is hostility towards regulators from the private sector and hostility towards consumers from regulators. That's where we have to start off, where we have to find each other, where we say, as parliamentarians and as developers, as people who are there for pre-consumers, that we find a common ground where we say no amount of legislative law it is intended to oppress the other, but it is rather to benefit everybody across the board. So as lawmakers in parliament, I think for most of the time we're always open to receiving whatever input we're getting from developers who are quite actually most resourceful as opposed to what we're doing. So I think it is all in a give or take situation where those on the one end provide to us, and us on this end we receive and we give back to them what is most relevant to the public. I think that's where we need to find each other. We just need to find inclusivity in everything that we do.
Thank you very much, Honorable. Any other? Yes.
Can I add?
Yes.
When it comes to multi-stakeholder engagement, one of the things...
You
can hear me?
Yeah.
One of the things we found out at the Interparliamentary Union working group on science and technology is that our parliaments hardly engage with scientists. So you'll find that parliaments have various committees, but we were yet to find a parliament that has a committee on science and technology. So you will find the scientists in our country are doing their thing, innovating, moving ahead, and Parliament is making policies that sometimes impact them, but we hardly have forums where you have parliamentarians and scientists meeting and talking. And what we are saying in IPU, and IPU is now developing a charter on the ethics of science and technology. What we are saying, it is important now for Parliament to deliberately find the scientists and technocrats within their countries to engage with them so that as we do policies, we are able to factor aspects that are facilitating to the growth of science and technology. But we are also able to engage on the ethical issues of human rights, of safety, so that the science, as the innovation happens, the innovation does not harm human life. So one of the things we need to do, or one of the most important multi-stakeholders that we need to engage with as parliaments, are the scientists and the technocrats. We also need to engage with other interest groups. And the example of Kenya, and I believe it's the example of many places, South Africa, the principle of public participation is a key principle within Parliament, where parliaments are supposed, even as they pass their laws, to conduct public participation so that members of the public, whom they represent, are able to contribute to the laws that they are passing. So if meaningful public participation is done by the parliamentary teams as they pass legislation and policy, it means that we are then able to have that collaboration. But there is also a trait that sometimes when we call for public participation, which we normally put in the newspaper, you will find only maybe 5 people have sent in a memorandum. So you cannot blame us for not taking on what the youth have done when we have advertised for a view on a draft bill on ICT and the youth have not sent in any memorandum. The women have not sent in any memorandum. A particular interest group has not sent in any memorandum. So that engagement means not just the parliament, but even other stakeholders must be ready to do the homework and to be able to then, when we want to pass a law, to bring in a petition and say, in this law we cannot see a clause that is including women. In this law we think what you have provided here is not good. It's going to be obstructive to the growth of innovation. We think this regulation is unnecessary. So we need everybody to engage properly on both ends in order for this to work.
Wow, thank you so much, Honorable. I think so. From my take from your contribution is first engagement, like engage the stakeholders. Parliamentarians needs to engage with the technocrats and the scientists. You have another point? Okay, but you wanted to add another point? No? Okay.
Sorry.
Yeah. Here you go.
I think one of the ways that Parliament can invest in terms of increasing
What happened?
one of the ways in which Parliament can improve or increase access to engaging other stakeholders, especially local communities and thematic groups, let's say for disability, for women, for youth, for rural communities and so on, is to also accept that the traditional methods of meeting are no longer enough. So we normally say people must submit position papers, must submit petitions, they must attend public meetings, but that is not enough. A lot of people now have to be engaged using the new media technologies. So parliaments must invest in public relations departments or communications teams that then use facilities such as Facebook, such as Twitter, such as Instagram, such as TikTok, because TikTok is where the young people are. And they have to have a staff member who is youthful enough, who engages young people for their views through live sessions on Instagram or Facebook or TikTok. And that way they are able to engage those communities. WhatsApp groups are very popular. Telegram is popular. So we must go to where the people are, and then we'll be able to access them easily. Because if we just use the traditional methods, it won't work. Also now we've got community radio stations. We can use them also to have live sessions where people can even phone in. It increases our ability to engage the communities. Thank you so much.
All right. Thank you. I hope you can hear me. I can't hear myself, but I hope you can hear me. Yes. Yeah, so I think my take to you is like, look at our current status, our current needs, how much resources we have, and then utilize them to reach our people. Like the social media, if we want, let's say, to engage with the young people, we have to look at where young people are now, which is like the social media, and then engage them. Do we have any other contribution? Yes.
It's okay? Yeah.
Switch
It's
it.
okay? I
Yeah.
can start? Okay.
Switch it on.
Yeah, it's
on.
okay. It's
Okay.
fine. Yeah, me am Ayobanga, member of parliament in DRC. And it's okay, no?
Yeah.
You can get it. Okay. For me, as I know, the work of of in our parliament, the major work we work in commission. The technical work is done in commission before we go on the vote process. So the commission work is normally open to the public, but the problem we have is the public is not informed when and what we are commissioned. Even us, ourselves, as member of the parliament, I'm a member of the telecom commission, but I'm not informed when the agriculture commission they are doing their work. Even if I'm allowed to participate, but I don't get the information. So first of all, we have to make it transparent, to put like a public calendar to show the public what we are doing, when we are doing. This commission is sitting on which law, so anyone who is interested will get the information and come. When we are doing the work in the commission, we have our expert who help us to understand the law, but those experts, they are becoming like a staff of the parliament. They don't give us really genuine idea. They don't even challenge us as they are supposed. But if the information of our work, of our calendar is public, then those people who are really interested on those topics can come and join and participate and contribute in those discussion. Sometimes it happen. Some of the law, we found people who get the information, they came and they really challenge us, and some of the MP changed their mind based on the input they receive from those ones. So I think to improve the participation, the collaboration, is better to make our working calendar public and allow and inform that everyone is allowed to come and contribute.
Wow. Thank you so much. So transparency. Yes, Honorable Catherine.
Now, a very important point that I did not raise. Now, when it comes to internet does not have borders. So even as we plan to do legislation is localized to a country. We must start thinking out of the box to see what we need to do, not just in your own country, but what we need to do regionally and also globally to factor the legislative requirements that can deal with the fact that open internet means there are no borders. Therefore, how do we deal with the issue of passing a law over a situation that is not just local? So we will need to allow innovation to happen. But when it comes to passing laws that must protect human rights, must ensure safety, must ensure security, we need to start thinking out of the box. For instance, when you have the abuse or child abuse facilitated through internet, just to use the example of that as one of the harms that are coming with engagement on the internet, we would need to start thinking out of the box. How do you deal with the fact that the pedophile is in America, the server is in Asia, and the child who's being molested is in Tanzania? How does the criminal law protection for such a situation look like? So we will need, beyond just doing a law for Kenya, a law for Zimbabwe, we will need, that's why we are saying in APNIG, what are these minimums that we can put in every country to provide protections while ensuring that what we have around innovation in our own specific countries may be different, will be different, but we must factor the fact that internet does not have borders. And that is a conversation that IGF, the United Nations, the regional bodies, AU, and the other sub-regional bodies, and globally must start thinking in order to guide. And as I said, for instance, in IPU, we are developing a charter on ethics, the ethics of science and technology, so that we then are able to agree on minimums that can ensure such protections.
Thank you very much, Honorable, for adding that point. And because of time, allow me to please move to the third pillar, which is on Africa unique challenges and opportunities. So, given the Africa unique context, what strategies can address geopolitical challenges and infrastructure gaps while ensuring digital policies empower all citizens? To the audience and to my online participants, anyone who wants to give a contribution on that, feel free. This is the networking session. Yeah. Where's the mic? Oh. Turn it on. Yeah.
Okay, could you hear me?
Yes.
Yes. My name is Kei Gong. I was a parliamentary. My name is Kei Gong. You hear me?
Yeah.
Okay. I was a parliamentary member of China, and now I serve to the World Federation of Engineering Organizations. And we think engineering capacity is a key factor for the development, especially in Africa, to grasp the big opportunity of digital technology to develop Africa continent. So the World Federation of Engineering Organizations is working on an initiative, 10 years long initiative called of Engineering Capacity Building for Africa, supported by UNIDO, UNESCO, and so on and so forth. We're going to launch this program next year in Africa. Perhaps we're starting from Kenya, Ethiopia, South Africa, and we're going to build a number of engineering capacity building centers in African countries. So we really need your support, because in China, our experience is that to develop a country, we need hard and soft side. For the hard part, we need infrastructure. We need invest to infrastructure, especially the digital public infrastructure. It's so important. And the capacity building in education should also be emphasized to give more investment into this domain and to build the capacity to make full use of those infrastructure to make economic growth. So I just talk about this, and we need your support. Thank you.
Thank you. Thank you for sharing the opportunity for the collaboration of initiatives. So I believe we have honorables here. Yeah, yes, Honorable Haji.
Thank you very much, and good morning to everyone, honorable members, and everyone here. Now, with Africa, there are very unique challenges when we talk about the digital transformation. But the good thing about it, the African Union actually has created a pathway, which is a master plan called the African Digital Strategy, or 2020-2030. That is, in very clear terms, tells countries or member states what do we need to do. And the key thing in that area is the digital infrastructure. That must be in the forefront. Because any building that doesn't have a good foundation, you are bound to fail. And this critical infrastructure is fundamental, is at the bottom, which means countries actually have to ensure that those critical infrastructure is in place. Then every other thing else is the building block can come on top of that. And the other one aspect is about education, like the capacity building my colleague has just spoken about. We must look at the way we teach in our curriculum. I keep saying this all the time. But even if we have the infrastructure, but the curriculum in our senior secondary school, in our universities do not match really where we want to go, we will not get there very quickly. So the infrastructure we build, together with the curriculums we teach in our schools, must match, so that those students that are graduating, the professors, etc., can actually help to align everything so that we can get to where we need to get to. So the capacity building, which is the education, is actually crucial. The other one also is about collaboration. We live in a world where collaboration is necessary. My colleague previously talked about security, but security is everybody's business. You cannot secure Kenya and you live Tanzania. You cannot secure Tanzania and you live Gambia. You cannot secure Gambia and you live Senegal. It doesn't work. Now, the trend now in Africa is about creating laws called mutual legal assistance. That's what we have done in Gambia, where we collaborate with our neighbor in case there's something happens in the Gambia, but the person who committed the crimes in Senegal, because of that law called mutual legal assistance, Gambia and Senegal can work together to ensure that person is, is apprehended. Now, with the way things are going now, you will see that somebody is going to be in one country, use another system in a different country to commit a crime in a third country. Now, how do we ensure that we work together? And this is exactly where we members of parliament, we have to take keen interest in the mutual legal assistance laws that we actually have, or if you don't have, you need to think about it. We already passed ours 2 years ago in the Gambia, but it's very essential, the region that you work in, the region that you are in, to ensure that you actually have that, and cross-regional and also then intercontinental. We have the Interpol, yes, but we also have the AfriPol. The AfriPol is really very active in the fighting cyber crimes, capacitating the police forces across the continent, and at the same time helping also in investigation. But they cannot prosecute; they investigate and give to member country, and we move on. Thank you very much.
Thank you, Honorable. So capacity building and collaboration. Any other contribution? Let me see if I have any contribution from online. I don't. So any other contribution from on site? No contribution. Okay, so since there's no contribution on that, now I would like us to have a closing takeaway session, right? Yeah, so we had a long discussion. We have discussed about a lot of things, and we had like the 3 pillars that we had different questions that we discussed on. So now I'm opening again the floor to the audience. So what are the key takeaway that you have taken from today's discussion? The key takeaway, something that you want to take back at your home country, something that you have learned, something that you want to take to your organization. What is something that you have learned from the discussion? Yes. Can I get assistance to pass the mic?
On my view, what I learned is that as a parliament, we have to know that when you are dealing with internet governance, we are not putting law just for our own pleasure. We are putting law that will impact other people's life. So we have to first of all to make sure that we are getting their input, and we have to be the one to make the first step toward them, going and look for them, not just working in our room and waiting for them to come to us. We have to make that approach to look for them, to make sure that we have all input from them, and that will be able to put in place a better governance that will be better for all of us, because even if we are the parliament that either we are young, we are women, we are also part of that world. So it's better for us to be the one to make the first step and to go toward those other stakeholders, and to make sure we get their input before working on the law.
Thank you. That was a very good takeaway.
Thank you very much. Maybe just to add on what he has said, as my name is Susan Dosi, Member of Parliament from Malawi. Just to mention that we really need to collaborate more, because if we do it alone, we will not get there. As Africa, we really need to have one voice. As parliamentarians, we have to work with other stakeholders to make sure that we come up with laws which will really help us as Africa. Maybe just to mention that sometimes, most of the times, parliamentarians are left aside. When it comes to maybe coming up with laws, we are at the end, at the receiving end. When we receive that law, when we go and maybe do some consultations, it's at the end of everything. I remember one time we had a conversation with the Ministry of Justice in Malawi, where we were told we have done this already, and what we just want to hear from you as members of parliament is what's your take. But it was at the end. They have already done benchmarking, they had already done everything, and they're coming to us at the end. They want our input, which we even said, even whatever we can say at this point won't be taken seriously. So I think we have to be consulted. We have to work together from the start up to the end, so that whatever we input in these laws that we even pass in Parliament, we are able to know that this is what we are passing. Because it's not good to come to Parliament and then we say we are passing this law. At the end of the day, we are the ones who do oversight. At the end of the day, compliance is not there. People are not complying. They're not doing anything. They are not following the laws that we have made. Because even us as members of parliament, we were sidelined maybe in the development of those laws. So we really need to work together, collaborate more with other stakeholders, and have one voice and as a team. Thank you.
Okay, so engagement and consultations from the beginning, engaging the parliamentarians. So to my panelists now, any closing, something that you would want to say before we close?
Thank you very much. A number of things I would want to say. One, all sectors have laws that are currently guiding the sectors, but with the digital technology, my view is that all those sector laws would have to be reviewed. For instance, now telemedicine. The current public health law in Kenya provides for all matters medicine, but it has not contemplated how liability would look like where a consultant in Tokyo is providing services to the clients. So we will need to relook at that. It is the same thing with the criminal. We've always had cross-border collaboration around criminal matters. But crimes committed through the internet, we have not thought through that properly. So usually you've had bilateral agreements where you agree with country X on dealing with each other. But our laws have not yet provided that. So one of the things that was happening in Kenya, even the judiciary has to be trained on how to innovate and adjust and adapt to deal with crimes that are committed over the internet. So what I'm saying is that with the digital technology, we will need adjustments in policies cross-border. I like the point that has been made by the World Engineering Organization that we also need capacities to be enhanced in Africa, not just within the school curriculum, but even with other communities. Even basic digital skills, we will need to provide that basic education, for instance, to the traditional mother in the village who is selling vegetables, but is using the man next door's mobile to receive the money and is paying a commission on something very small. So if we start doing communities around of internet to actually give that basic education to that mother, to the senior citizens, we will grow the economies. We will also protect them from local little frauds that actually undermine them. And then if you look at the sector, like the employment sector, we also need to start looking at the exploitation we have young people employed in Africa being paid $2 an hour, and they are doing exactly the same job of somebody in America being paid $20 or $30 for the same thing. So we will need to start bringing in ethics so that we don't have exploitation of the fact that the African or other countries' labor regimes are not good. So my view is that there is plenty for us to do, and there is plenty for us to learn, and we hope that as you bring in parliamentarians and give them capacities, you will help to fast track getting the correct frameworks that we need in order to enhance digital technology in Africa.
Thank you very much, Honorable Catherine. Anything you want to say? You're good? Okay, so I'd like to thank each one of you, including my online participants, for engaging actively in this session. I'm looking forward to seeing you around in other sessions and engage with you. Have a great day.
Hello everyone. Good morning and welcome to this very important session on digital health and self-care. Can we replace doctors in the primary health centers? And the whole idea of IGF, as you know, is the world's most impactful forum on internet technologies.
Excuse me. Is Peter with you?
Yeah.
Peter? On the Zoom?
Yeah.
Could you tell him to check the chat?
Okay. Peter, can you check in the chat? You joined in online? Yeah. Thank you. Yeah. So our goal as IGF is, to shape the internet we want, and is a constant body of the United Nations that advises UN on internet-based issues. I'm Dr. Rajendra Pratap Gupta, and I chair the Dynamic Coalition on Digital Health, Digital Economy and Environment. This session is the Dynamic Coalition Digital Health session. With me, I have Dr. Peter Preziosi from United States, the president of CGFNS. I have Dr. May Siksek, CEO of the Innovation Network Canada. I have Mavish P. Vaishnav, president of Digital Health Associates and head of Patients Union. I have Zaw Ali Khan from the American University of Barbados. And I have not missed anyone. I'm myself here with you. So let me first walk you through why this important session. Because all throughout we have been talking about technology, and every sector has embraced technology. Healthcare is the last one, but look at the impact it can create. So I'm going to take you back to history. Let me check if the slides move. So this is the session we hosted last year at IGF in Kyoto, Japan, where we talked about conversational AI and low income and source settings. The whole idea was to check the level of awareness people have on the word conversational AI and what is the relevance. To most of us who are in this field, it is chatbots. But trust me, despite asking people, we couldn't get a speaker from our vast network on LinkedIn. When we wrote we need speakers on conversational AI, so-called president of the associations in digital health said we do not know this field. Actually, it is chatbots. We had a very good panel with us that time, the head of AI at WHO, the president of Humans.ai, Sabin Dima, Dinu, who is the CIO of United Nations Staff Pension Fund, and Dr. Olebusa from Nigeria. We ran a good session, and a year now we are actually talking about will AI replace doctors. But let's go back 10 years into history. I think I need to check. Can you move the slides, please? So as the chairman of the board for HIMSS India, 10 years ago, I told doctors that the future is tech, please, tech, IGF. This is what the slide was. The technology eliminates middlemen. Today, if you doctors don't need technology, technology would not need them in the future. And 10 years fast forward, we are in 2024 heading into 2025, which is just a decade after. And look at what has happened. And let me also go back to share what I presented at that point in time. I think I need more clicks. Yeah. There's some issue with the presentation. We're just going to sort it out. I think whenever we talk about doctors and AI, some technological glitch comes in, which I'm not very surprised because they are a very powerful stakeholder in this discussion. Can we manually move the slides, please? Can we? So let me talk you. Technology moves faster than I can. I'm sorry about that, but that's the way it is. Sort it out. So no. So look at this slide. Those of you who have used the PCO booths to go and make calls and the long distance trunk calls, and what happened when the cell phone moved analog to the technology moved from analog to digital. We can make calls from cell phones wherever we want, whenever we want, and now you can use your watch to make phones. So effectively, technology has progressed, and what it has done is eliminated the middle person. You don't need to go to a PCO booth, you don't need to use lines for a trunk call. You can use it from your cell phone. I use my cell phone. I sometimes don't carry my phone at all. Next slide, please. Next. And this is another interesting slide on the entertainment sector. We had this, a huge antenna. Sometimes it was 70 feet. You need to connect to get to watch maybe 7-8 channels. What happened when it moved, entertainment moved from analog to digital? You move to a set-top box, and now anything you want to watch, you just pay for it, and it's at your convenience. So what it does, technology is taking the middleman away. Again, it took the middleman away. There is no need for antenna. You don't need a set-top box. You don't need a provider of that service in your area. You are connected globally through the satellite system. Next slide, please. This is my most favorite slide. At one time, Kodak and Fuji were fighting for the color of the prints, and they were talking about the quality. Digital photography came in, and Canon actually is the one which came in, and what appeared was both of them literally became bankrupt. But that was not the end of the story. We have now mobile phones which have the camera. So you can look at what has happened is we have moved a whole lot of generation moving analog to digital. Now in everything you will see is that we eliminated the middleman. Same happened with libraries and the bookstores. Today you have your Kindle or your e-book reader, and you can actually read whichever book you want. I carry hundreds of books on my Kindle, and what effectively happens is technology gets you closer to the user and eliminates the connector. Now if I take these slides back to my health, what I believe is that when a product, service or a sector undergoes a digital transition, analog to digital, intermediary goes off, and healthcare has a lot of intermediaries right now. So I think the fate of clinicians is a foregone conclusion, and this is what I've been saying for over a decade. I'm going to stop here and look at asking my expert panel, which is with me, is like, what do we feel about the future? Are we going to have a day where AI will see you now is going to happen instead of the doctor will see you now? So I'm going to put this question to Dr. Peter Preziosi. Dr. Peter, thanks for joining us. I think it's too early in the morning or too late in the night for you to join us, and sorry for the odd hour, but thank you for taking out time. Peter Preziosi is the president of CGFNS Global, and he's done extensive work in terms of trying to provide relief to people where clinicians are in short supply through nurses. Dr. Peter Preziosi, what's your experience of working in Rwanda? Would you want to share with us?
Sure, definitely. I'll be very brief. But Rahendra, I agree. I think it's here and it's even coming. And I agree with you about the displacement as we look at these medical brains that are coming that are powered by AI and AI engines that are looking at technology. Just for background, I lead a 50-year-old global assessment and certification organization supporting the mobility of nurses and allied health professionals worldwide. Earlier this year, we began searching for the right partners to evaluate some technology-enabled new models of care in the primary care and public health space. Working with the Society for Family Health in Rwanda and a remote patient monitoring device manufacturer, MedWand, what we did is we set out to establish a model of nurse-led primary care that would be easily replicated across the globe, cost-effective, codependent on technology, and one that promotes access to care and prevention. This model will contribute to already existing task-shifting initiatives that help to bring care closer to the communities. The Society for Family Health is Rwanda's premier organization for providing health to rural communities throughout Rwanda by constructing and equipping health posts operated by nurses. Under our protocols that we've developed, we've embarked on a journey that we believe will impact health prevention, health promotion, and preventive care around the globe. We see this by empowering nurses, community health workers, and other allied health professionals by equipping them with the right technology tools to provide care, and to seek for a second opinion when they have to. So this is still emerging that we're looking at. We believe this care solution will reduce the number of referrals that are transferred to upstream health facilities that are already crowded and lack adequate resources, and make the model for an integral part of primary health care. The model will also contribute to job creation by allowing nurses to increase their healthcare portfolio and entrepreneurship. So far, we're in 5 remote locations that have been identified in rural Rwanda that center around designated health posts and district hospitals. Healthcare workers at those locations have been trained on the MedOne device that captures all vital signs and some more functionalities critical in providing primary care. So within this remote patient monitoring device, it includes a thermometer, stethoscope, ECG, EKG, pulse oximeter, a high definition camera that can be used to view inside the ear, nose, throat, and skin, as well as integrate with any blood pressure monitor, glucometer, and spirometer. The device is synced with a tablet, which is used to capture, store, and transmit information, and also make it possible to have real-time consultations via video conference. Early indicators have been very positive. The health post workers have shown the ability to adapt to the technology and have communicated the anticipated decrease of time needed for diagnosis, with the ability to send data real time to advanced practice nurses. The community has shown an increased receptiveness and indications of better compliance when diagnosis is accelerated. Travel times and distance are reduced significantly. The physician staffs receiving information in hospitals in the major hubs are less burdened to have to track data, and their response time is reduced on their behalf as well. So overall, we're confident that our original intent will have the strong empirical data needed to impact the lives of many by reducing cost, improving health, increasing reach, and empowering a new upskilled health workforce. Over the next few months, we'll be gathering hard data to prove that the nurse-led primary healthcare model can have an impact in rural communities in Africa and then also beyond in other continents. Thanks, Mahendra.
Thank you so much, Peter. And I think you made very important points of moving from a doctor-centric system to other health professionals like nurses. And we have our work which we are doing with nurses and pharmacists, and we believe that the future of healthcare lies in digital health plus nurses or digital health plus pharmacists, and not necessarily just doctors. That being said, are you also leveraging artificial intelligence, and empowering nurses to take on-spot decisions with regard to patients' queries, needs, and serving them?
We have a new initiative actually funded through Johnson & Johnson that will be started in Ghana. It's AI-powered sonograms to detect hypertension in pregnant women to prevent the maternal child deaths that are so prevalent in Ghana. So we're looking at that. There are other initiatives, some point of care solutions that we want to test in other areas. And actually, we've started to talk with you and love to work with you on looking at various primary care providers that could really help. I think nutrition, registered dietitians, will be very useful. And I'm pleased to see that the International Patients Union is on this panel, because I think that that's an important role to really look at this from a consumer perspective. Because I think what we are going to have to look at is helping to provide self-care solutions to the patient community before they even need to get to nurses, allied health professionals, and others.
Thank you so much, Peter. And I think it makes my job easier to switch to the Patients Union representative here. Mavish, you run the International Patient Union, and is there something that you want to share with this panel on the prospects of replacing the need for doctors in settings where they just need OTC-based medications or acute care problems? And what are you doing in that area for the patients?
Good morning, everyone. This is Mavish from India, and I lead the International Patients Union. In the healthcare sector, if you see, everybody is organized, be it doctors, nurses, pharmacists, but patients are the one who are unorganized. Nobody hears them. So at International Patients Union, we have a platform, the Patients Union, where we provide a platform for the patients to voice their opinions, their concerns, and share their views. They can share their views with other patients so that they can get well managed for their diseases. And if you see at Patients Union, we are making artificial intelligence the authentic intelligence. Medical science is a science. So if you say, I have a fever, I'll give you a paracetamol. If you say, I have a cold, I'll give you the medicine for cold. If you have a pain, I'll give you the medicine for pain. That's a painkiller. But if all these things can be put into a system which is AI backed, it can actually help doctors as well as patients. Patients doesn't need to travel from 40 kilometers or 30 kilometers to just visit a doctor for primary care. The doctors can be saved from their timing to see the secondary care and tertiary care, the surgeries. And through this system, we at Patients Union are developing a program. We have launched the Patient Centricity Index, through which every system has been put, like the symptoms of the diseases. If you just open your app and say, I have a following symptoms for my knee pain or something like that, it will throw you with the diseases, the right prescription for it. And this way, we can actually save time for doctors. So yes, AI is important and can be helpful in the primary care.
So you're saying, Mavish, that patients in India will be able to get their information about healthcare needs not from the net, which is unverified, but from Patients Union without even meeting a doctor. Is that right?
Yes.
So effectively, this will be probably the first experiments of its kind where patients can get information about primary care from an artificial intelligence backed system.
Yes, right? It is an authentic data that would help them.
Fantastic. Zaw Ali Khan is with us from the American University of Barbados. Zaw, you run an academic organization, but you also are a tech czar in terms of bringing new tech to healthcare. Given what's going around the world, do you think it's time for us to prioritize where do we invest clinicians' time and how much of their role we replace with technology? What's your view on that?
Thank you, Dr. Rajendra, for inviting me to this session. I feel that there are certainly many use cases where the clinician's role can completely be eliminated, not just for the sake of providing convenience to the patient, but also for reducing the workload of the doctors themselves. So there are plenty of use cases that would see the replacement of doctors with technology altogether. But there are certain, I feel, challenges where it's a softer approach which will help, because as far as the regulatory issues are concerned, you need to have doctors on board to approve these tools. And in order to have them on board, you need to make them feel safe and give them the confidence to use these tools. So for that, I feel that the role of academic organizations is paramount, because the doctors that have already practiced their whole life in a certain way, asking them to change, asking them to adopt a new thing, means you're basically telling them that whatever you were doing so far was inadequate. There were some limitations in that. And that's a very hard or very bitter pill to swallow. And instead of that, if you were to highlight their own challenges and how tech tools and technologies are sorting those issues, then they'd be more on board with this idea. And this is what I'm talking about, the more experienced doctors who are at the tail end of their career. But of course, they are the stalwarts. If they were to, join these pioneering efforts, then everyone else will follow. At the same time, you also need a new generation of doctors who are capable of navigating these digital tools. So over there, again, the academic organizations have a role of making sure, first of all, these academic organizations, any of the teaching hospitals, they themselves need to adopt more and more digital health solutions so that they can demonstrate to the students. Unless they adopt themselves, they won't be able to demonstrate. Secondly, once they have demonstrated all of that, they need a structured course for that. And we have been fortunate enough to partner with the Digital Health Academy for providing our students with an elective for digital health. So that's a structured course which is delivered by experts from around the world. And lastly, so first thing I said, more adoption of health tools by making sure that the healthcare workers don't feel threatened, at least at the get-go. And actually, it is not a threat, because the main problem that you're trying to solve is the shortage of healthcare workers, right? And a related problem that you're trying to solve is healthcare worker burnout. So if you're solving burnout, every healthcare worker would, help you achieve that goal. So focus on burnout, focus on, from the perspective of healthcare workers, focus on burnout from the perspective of patients, focus on medical errors. From the perspective of healthcare organizations or healthcare systems, focus on the shortage of healthcare workers. So it's the same problem, but just with three different angles. And once you've done that, then all the stakeholders will come together to adopt more of these solutions. And ultimately, of course, everyone, once they start seeing the benefits, I'm sure that 1 or 2 generations down the line, they'd be surprised that, we used to have PHCs. So that's the future that I envision, and I hope that we're able to accelerate that.
So this is very interesting, the point that you make. And at the Academy of Digital Health Sciences, where we run courses on the doctors, our experience has been very different. The doctors who take courses are like 30 years, 40 years experience. And when they pass the course after 1 year, they are as excited as kids, sending what they created to their sons, grandsons, and the unfounded fear becomes forces that help them. So that's what we have seen in doctors. So we're going to see a competence divide. But what is a worrying and probably a call to action for clinicians, everyone I guess, is like the slides that I showed. The technology didn't wait for the sector to evolve. It just disrupted it. So the fact is that whether doctors adopt it or not, technology is going to invade their turf. I mean, that's the fact of life. I mean, our studies show that some of the specialities will get totally replaced, which is a very, very strong statement to make. But when I look back at the statements made 10 years back, they're actually come true. I think fields like radiology, dermatology may not be doing well with just doctors. AI can do a phenomenal job out there. But there are surgeries where robotics plus surgeons are needed. Specialists may be needed for neurology and other cardiology sector. But AI is getting matured with time. I mean, that's what we've been seeing. And now let me get to Debbie Rogers, who joined us from Africa. Debbie, you run village outreach in Africa, and countries like India, Africa, and other LMIC countries face a huge shortfall of doctors. What do? Do we wait for doctors to get prepared and be MBBS, MD, MS, or do you bring technology? Because there's nothing that exists. What do you say?
I definitely am a proponent of bringing technology into the mix to relieve some of the burden on the healthcare system. In sub-Saharan Africa, we have 14% of the world's population, but 25% of the world's disease burden, and only 3% of the health workers. So if you look at those stats, it's very easy to see that if we just keep trying to train more and more health workers, we're not going to get anywhere. We have to be using technology to be able to augment the work of health workers. And the way we think about this is we think about moving care from the facility. A lot of workers happen to move care into the community with community health workers. But with a mobile phone, you can move care from the facility to the community to somebody's own home. And so we use very simple technology like SMS and WhatsApp to communicate directly to citizens, to help them from a self-care perspective, but also to access the right services at the right time. An example of this is a program we've been running for 10 years in South Africa called Mom Connect. And basically every mother who goes into a clinic for her first ANC visit is signed up to the platform. And throughout her pregnancy and up until the baby is 10 years old, she is able to receive messaging, which will help her to care for herself and to understand better how to care for her baby as well. And we've seen really great results, both on self-care, so things like better nutrition and uptake of breastfeeding, to access to services like uptake of family planning after birth, improved attendance of ANC visits. So we can really see that something as simple as an engaging platform delivered directly to your mobile phone, you don't have to have any training. It's exactly what you do to communicate to your friends and family. That can have a huge impact on health, and it can relieve a lot of the burden on the healthcare system, so that the health workers can be doing the work that they really need to be doing and not the work that can be taken over by technology. And I think for me, I don't know if we can say necessarily that we will replace doctors, but I certainly believe that doctors who use AI and use technology will definitely be replaced by those who don't. I mean, the other way around, those who don't use it will be replaced by those who do. Because I think it's going to make their work so much more efficient and effective. It's going to make patient experience much better, and people are going to vote with their feet, and they're going to go where the patient experience is better. And I think that's definitely where I see things going, is very much more task shifting, different tasks going to different cadres of health workers, and those who use AI and use technology are definitely going to be replacing those who don't.
David, do you think, we have been always saying that doctors who use digital health will replace those who don't. But do you think there could be an extension of this, saying that the healthcare workers who use digital health will replace doctors who don't? Because I can tell you, this is not coming just because I'm sitting on this dais on IGF and I'm saying there's a hospital where they segregate the high-risk pregnancies with normal pregnancies. And I was told by the chairman of that hospital, who is a doctor, this hospital has been around for 76 years, that in normal pregnancies, the mother does not see a doctor even after delivery. It is the nurses who handle it. So, and they use technology. So just imagine how much precious time of the doctor, the gynecologist or obstetrician is saved, because the delivery happens only through nurses. And this is not a small number. I mean, I'm talking of India, and this hospital has been doing it. So, I mean, I'm, getting to the stage to conclude, I've always been an evangelist of technology. I was skeptics, in the beginning, thinking that it will not happen. But as I see over the last few decades, I think technology has been showing itself with great commitment and accuracy now. So do you think that other healthcare professionals, like, our friend Dr. Peter Preziosi is doing in Rwanda and Ghana, will other clinicians who use technology replace doctors? Because given, I see your numbers, India has the same problem. You have 25% of disease burden, 3% of workers. No way on earth you're going to match them over the next few decades. No way. So do you think technology
Yeah,
will...
I agree. There's going to be massive task shifting, and things that were previously deemed as only able to be done by certain specialists is going to be able to be done by somebody who does not have the same amount of training plus technology. So I do think that task shifting and moving from one cadre to another is definitely going to happen. And we see it happening already because just out of necessity. I mean, in sub-Saharan Africa, there aren't enough doctors to reach everybody. So a huge amount of the care is already on nurses. I do think, though, we have to think carefully about the fact that we still have too few nurses and we still have too few community health workers, and we still have a problem of burnout, which means that as fast as we're training people, we're losing them. And I think we have to think very carefully about, and I do believe this is an important role of technology, removing the burden from healthcare workers so that they can do what they really need to be doing, rather than things that can be done by technology. And I think that's going to help an enormous amount to relieve that huge dearth of healthcare workers that we have worldwide, not just in sub-Saharan Africa.
Thanks, Debbie. I'll add to that. We are very lucky to have one of the leaders in India who is the president of the Indian Nursing Council, Dr. Dilip. What we have done as Academy of Digital Health Sciences, we have partnered with him to train 2 million nurses on digital health. And same thing we have now done with pharmacists. We're going to train 400,000 pharmacists on digital health. I think these could do phenomenal work, and I think by next year IGF we'll be able to show the impact we have created training almost like I think within now and then we should aim to touch 500,000 of them trained. Eventually we'll train maybe 3 million of nurses and pharmacists to take up some of the frontal roles. But having said that, now I have with me Dr. May Seksek. She runs the Innovation Network Canada. May, you have been leading the Innovation Network and you're building a new healthcare model. Where does technology fit in the model? Is it going to be more dominant than the clinicians, or it's going to be just again back to the same old model? And going by the fact that Canada is among the handful of countries which pioneered digital health. My very dear friend Richard Alvarez was the president and CEO of Canada Infoway, which was the first government organization to implement digital health. What's your take on that?
Thanks, Rajendra. I want to say, sorry. It's on? Okay. Thanks, Rajendra. I wanted to say that Debbie has brought up really important statistics and some critical information here. So the supply chain is really, the demand for healthcare rocketing and supply is still space. So the system is destined to crash at some point. So from my perspective, it's, again, going back to these stats, we really need to have technology take care of what's on doctors and nurses. I think that's really important. So in the system that we've developed, one of the main concerns right now, AI-based diagnosis and so on, is the fact that large language models will not hallucinate. So this is one of the things that we're working on. Oh. You can hear me? Okay, perfect. So one of the things that we really need to address is hallucination. Right now, AI-based diagnosis cannot be FDA approved or Health Canada approved, right? So this is one of the things that we're working on right now. I think we really need to address that, and we're working actively at Innovation Network with academic organizations to address this issue so that we can actually have an AI-based system that can be qualified to do such tasks without a human supervising it. And I think that's really important because then we can save a massive amount of time from healthcare professionals. Doctors, for example, in Canada, they get paid by every 15 minutes. And I mean, most of the time, it's very difficult to actually address a medical case, especially with complex medical cases, within 15 minutes, which means that they're not really able to do their job as well as they can and they should. So the way I think about it is that it's having, for example, AI-based medical diagnosis is like having a co-pilot for doctors. You wouldn't set foot on a plane if you don't know that there's a co-pilot that's for redundancy. Yeah, we go to doctors and I work with a lot of physicians, and I hear from them that mistakes are often made and often they get buried with doctors. So it's important to have these tools for doctors to not just empower patients but also empower doctors as well. Another aspect I want to bring is the fact that I don't think they'll ever be able to, AI will ever be able to completely eliminate doctors. I think we'll always have, but we'll save tremendously in terms of the time that's needed from doctors. I think there are two aspects here. One of them is the fact that we're always, we are human beings, and we need that interaction and assurance from doctors. We also need to understand for especially complex medical issues where we need to look at different factors like ethnic background and culture and so on. You need to have that contextual understanding. Now, having said that, this has been a huge source of medical errors that actually literally led to, fatal issues for patients. So it's a double-edged sword. Doctors can be really good at understanding contextual context for medical cases, but at the same time, they can also make mistakes because of context, because they're drawing patterns and so on. So again, going back to having that co-pilot from technology is really important.
May, and I would ask you that if you were to start moving from your your driver driving you versus a car which is driven autonomous, would you do that?
Would I use an autonomous driving vehicle?
Yeah.
So in fact, I have actually worked in compliance for a safety standard for autonomous driving vehicles. I've worked very closely on this field, and I can tell you. So my job was actually to really oversee where mistakes can happen and the system could result in fatal issues. And because of that and it was quite a complex process. So I worked with and you can see that mistakes could happen, and compliance is extremely important. So you really need to have a standard where you actually have to check things. So, and this is going back to, we really need to qualify AI.
So this is the month of May, I was in US delivering the opening address at ATA, and I decided to use an autonomous vehicle, Waymo. I didn't have a problem,
Yeah.
Is the worst thing, to a doctor you go once in a year, probably twice in a year. If you're a chronic patient, maybe multiple times.
Yeah.
But in a heavy traffic in the United States, in the morning or evening, you won't drive and take the risk. But I decided to do that. Let me tell you, it was pretty safe. If I can trust a driverless car and reach there, again, going back to the presentation I made 10 years ago in HIMSS, what essentially technology is doing is taking the middleman away. There's no driver in the car. I reach my destination on time. The driver doesn't, fleece me by taking a longer road, charging me more. I'm just charged. I go to my destination. So if we trust a driverless car, why won't we trust a doctorless surgery with a robot?
So I totally agree with you, but driverless cars have a standard that they must be compliant with. And I can tell you it's a very, very complex and big process. So you've got auditors that come and make sure that it's compliant. And we can do that, Rajendra, with medical-based diagnosis. And I think we're getting close to there. We're not 100% there yet. We can't qualify it yet. But we need to get there. We need to have a standard, and we need to be able to say we're compliant with the standard.
Yeah, and I agree. And going to Mevish, you're talking of patients. Are patients ready to accept this kind of technology? I mean, Mevish, I want to throw this question that you run Patients Union. Are patients ready to accept AI as a doctor? So if we say AI first, doctor later, would they accept it?
Yes. So there is a study where it states that 6 out of 10 patients know digital health, but 2 out of 10 doctors know digital health.
Yeah, that's about knowing, Mevish.
It's the awareness that is important. and doctors are more prone towards, when I can share an experience with you. My family member went to a doctor and she asked her, "Can you prescribe me DTX?" She was like, "What is that?" So she is not aware about DTX. So it gives a thought or maybe a doubt for a patient that if a doctor doesn't know about this technology, how will she be able to help me in my managing diabetes? So yes, patients are more prone and they are more accessible to AI. They would love to be a part of AI where there are zero errors. I would not say zero errors, but negligible errors.
Thanks, Mavish. And this brings me to a very important point that May 6 grades, about the empathy. So May, today my social media knows more about me than my doctor. They track me what I do using my phone. It tracks me what I do using my computer, what I like, what I do like, the tone through my phone when I talk. So it could be more personable to me in terms of personalizing the content, the way I speak, the way I like, and how many seconds I need a response. So if I have a AI doctor, that AI doctor would be more empathetic, won't get angry because I get angry very often.
Mm-hmm.
So do you see that technology is better in terms of empathy than a human doctor?
Actually, yes. So, but having said that, I do think that technology can be better than doctors at in terms of empathy. But having said that, sometimes a patient at a hospital will need, for certain cases, they will need humans. So all I'm saying is that we can't eliminate doctors in terms of empathy. And I want to say that, using AI-based tech for medicine is critical, actually, right? We actually are losing lives right now because people can go to a clinic and not have access to the right diagnosis. And so I talked about the tiny bit of hallucination that an AI system does, but humans make way more errors than doctors. I just to be.
You're making my job easier. Thank you.
It's true. I need to. We need to talk about all aspects of this, right? So
that's a reality check. So going to ZAW, that's ZAW running an academic organization where you do research and you work across multiple countries. What do you think about AI being more empathetic, being more accurate? Because these are two challenges that will come in the way of creating trust for technology.
Yeah, thank you, Rajenji. So, as far as AI knowing more about me than I know about myself, I would frame it that way. I recently got to know that, if you ask ChatGPT, how would a typical day, based on what you know about me, if you give a ChatGPT the prompt saying that based on what you know about me, what would my desk look like, or what would my workplace look like? So it's able to recreate that quite accurately because of the frequency and detail of interactions that we are having with these AI models. So imagine if we were to have health related interactions with these AI models as frequently as we are having work related interactions. That would be many times more. In terms of magnitude, I would say exponentially more personalized than what any doctor or a healthcare worker can provide. It's of course not physically or humanly possible for doctors to provide that level of personalization. As Ms. May said, that doctors are getting 15 minutes with the patient, and in UK I've heard that they get 7 minutes or 8 minutes on average. So it's impossible to even diagnose many of the conditions in that short amount of time, let alone give a personalized, empathetic care to the patients. So I agree that digital tool has that potential.
On the timing we see that some countries they get 34 seconds. If I remember correctly, it was Bangladesh, where doctor gets 34 seconds or so. So even if it is any other country, 34 seconds, 1 minute, you can't even pronounce the name and the problem of a patient. How will you diagnose? That means you have made up your mind to prescribe something and the patient has just come in on time. Yeah, so that's another, that technology won't do, by the way, because there'll be a digital footprint of what you do. So Peter, coming to you, given your global experience and you are a nurse by training,
That's
and I
correct.
think you are closest to the patient than the doctor. That's how I call it. Like doctor is still close to God, doctor, nurse is closest to the patient. How do you see this relationship between technology, patient, and the clinician evolving?
Yeah, I agree with many of the comments that were stated earlier. I think the challenge is that we tend to be focused throughout the world on a medical model. And the challenge that we face in communities is that clinicians are not working at the top of their capabilities, and for a variety of different reasons. Many times, if you're talking about, physicians, nurses, pharmacists, they're struggling with the morass of administrative paperwork that's not necessary for them, takes them away from direct clinical care. As a number of the panelists were mentioning, these AI-enabled tools, digital health tools, are partners to really enable people, clinicians, to be able to work at the top of their capability. But there's so much more that happens, and it's very different based on the jurisdictions that you're talking about, the different countries that you work in. From a regulatory, legislative perspective, there are professional turf battles. And why I'm so thrilled to see the patients union here is that we've really, we talk a lot about patient-centered care, but we've got to really bring that patient involved and engaged in the services that are being provided, because they should be much more empowered in terms of what it is that they need to do. Because if you look at it, just take the issue of obesity. Obesity is rampant now around the world, because people are not, eating properly. They're not exercising properly. Aging is a challenge that there's no cure for, really. Maybe there will be a digital cure into the future, but the issue is that there are many health issues that don't succumb to a traditional medical model. So we just have to start to begin to turn some of that upside down and look at the appropriateness of care. I think it was Debbie that said earlier, looking at the right care at the right time, right place. These are the issues that we have to get better. And I do believe digital health solutions will help to augment and assist us in moving more into those areas.
Peter, so much. And to those who have joined online, I would say put your questions in the chat. We're going to take questions. We're going to dedicate substantial amount of time for questions. But this brings me to Debbie. And Debbie, you know that countries like Africa, India, with billions of population and with so much less resource in terms of doctors. Of course, India in the last few years has done phenomenal in terms of adding doctors. We add now 175,000 doctors every year, which effectively means that in next 5 years we would double the number of doctors we already have. Having said that, now with technology taking a dominant role and number of doctors coming up more, and now going back to Africa as a region where some patients may not have seen a doctor in their lifetime, how will they understand the difference between technology and a doctor? I mean, if I present them, hey, look, there is a doctor you are talking to, and I'll put a disclaimer, there is a doctor, this is an AI based doctor, they haven't spoken to a real doctor. What do you feel would be an opportunity or a challenge for a country like Africa where someone gets addressed empathetically through technology? How will they differentiate? What will be their response on this? I mean, they have not seen a doctor. They are talked very well. They don't get 30 seconds. They get 30 minutes if they want. They can chat. They can tell all the problems and the AI will tell them, look, this is your thing. And if they get the right advice, I think as you said, as Dr. May said, and as Dr. Zol said, if they get the right advice, they would come back to this for more, because they would start trusting that voice that talks to them, and it will be the voice that they probably like the most. What do you think about that, Debbie?
I think you bring up an incredibly important topic of trust. And I think we, as we provide digital health solutions, and we work very, very hard on making sure that they are trustworthy, that people love the services, that they understand that the service is there to support them. And in doing so, we are able to get them to change their behavior in a way that they wouldn't be able to if they didn't trust the source that it was coming from. Now, I don't know whether people, I don't have the knowledge or have done the research around whether people will trust AI or doctors more. I think it's probably going to be down to a personal perception. But I do believe that you can people can trust AI and people can trust digital health solutions. And I think that that's incredibly important when you're building these solutions. As an example, we integrated a diagnosis engine into Mom Connect. It's a diagnosis engine that we didn't develop. It's called Ada Health. And we integrated it via WhatsApp into Mom Connect. And we had a higher completion rate of going through diagnoses on Mom Connect than on the Ada Health app. And the best we can put that down to is that mothers actually trust the Mom Connect service. Another example of trust is we get inundated on Mother's Day with pictures of people's babies and messages thanking us for the support that they've been giving. And good morning, Mom Connect, and good night, Mom Connect messages. Whether it's a piece of technology at the end or it's a person at the end, you can build trust and you can get people to engage with them. And sometimes they believe that there is a person on the other end, and sometimes they believe that it's AI on the other end. And that depends on the usage and the person as to what you want to try and encourage. For example, in our sexual reproductive health and rights platforms, we find that youth want to speak to AI and not to a person because they've been judged so much by people. And so in that instance, for example, it actually is very helpful for us to have AI. So I absolutely believe that people will be able to engage with AI, trust AI, knowing that it is AI, they may trust it even more than doctors sometimes, depending on what their experience has been in the past.
Thank you, Debbie. And I think you bring that very important point of the world called engagement. I think technology with no denominator of money at the point in time and not being a human, it could actually spend time probably the patient wants to spend with, and engagement would lead to maybe better outcomes if the advice is right based on standard clinical protocols, which means, as you said, AI could be trusted more. I mean, as they send you pictures, I've seen your work and I really admire what you have done, is that people feel that there is someone with them when they want it. And that's what is missing in healthcare today. And I think Peter Presusi would allude to this. But Peter, given the fact that we have nurses and there are success stories of the nurses and how they touched and transformed lives, do you think that the future of healthcare lies with leveraging this workforce, nurses and technology together, and somewhere maybe technology? What is your take on this?
Yeah, that's a great way of putting it, Rahendra, is liberating all clinicians, nurses, given that they're 29 million worldwide, the largest profession. Absolutely, we need to, we start with them, but there's so much more out there, like the work that you're doing with pharmacists and others. We've got, we're doing much work around rehabilitation care with the World Health Organization. And we're actually in Ethiopia looking at rehab care, driving that into primary care. A quarter of the world's population needs some form of rehab care. Yet so many clinicians are ill prepared to tackle this. And when you're taking a look at the challenges around war and conflict and working in these zones where you've got traumatic amputees and trying to reintegrate people into a quality of life, rehab care is incredibly important. But yes, liberating through, there's no magic bullet. Are these digital health and AI solutions the magic bullet? Absolutely not. As many people have talked about here, engagement. There are a variety of issues that need to help, but there's nothing obviously to be afraid of the technology evolution and emerging that as true partners. Again, I'll just emphasize it's also as important to liberate the consumer, the patient, and their families equally, with these technologies.
Thank you, Peter. I think this is a very important point of liberating the clinicians from their, too many tasks that can be handled, and also the consumers. Let me now jump and open this to questions from the audience. Then I have some questions which I will ask back the panel again. So if there are questions from the audience, we'll be very happy to take that. Can someone please provide the mic in the audience? And Sakshi, if you have online questions, please read out to us.
Sure, sir.
Yeah.
So, everyone, that was a very nice discussions. We have a few questions online. I'll just read them out for you. First one is from Ms. Arushi Negi. She asks, if we are planning to replace doctors with digital health tools, how do we make sure they are not compromising quality of care?
Peter, over to you.
Well, this is exactly one of the reasons why we're going slow and really testing these point of care solutions. Many, there are countries, high income countries, Canada, the U.S., India has done, a great deal of this kind of work where you're looking at, testing out these solutions, integrating that into clinical workflows. I don't think replacing is the right word, but really augmenting. And there are AI-powered medical brains now that are helping to augment 92% of the workloads of clinicians and practices, and most of this is administrative burdens. Rahendra was saying before, when you've got a physician that has only 34 seconds to go in, and they don't even have time to pronounce the patient's name and the diagnosis. So it's looking at the work differently and testing those solutions out and seeing what's best with the consumer to be able to optimize human potential.
Thank you, Peter. In fact, I would very much agree with you on that point. Recently in our office building, we had a plumber who always came and told us that his wife has low weight and she's coughing. And, we said, okay, why don't you get a tuberculosis check done? So he went and got an check done, and the sputum was negative. But the X-ray showed that it was tuberculosis. And the doctor would not start the treatment because the sputum was negative. So we did a telemedicine consultation through a tertiary care facility, and he said, just start the treatment. It is evidently clear that, there is tuberculosis. So it was technology that came to the rescue, but the conventional system of diagnosis and treatment or consultation didn't work. But sometimes it is augmentation, sometimes it is replacement, and sometimes it will be just the doctor. So having said that, Zaw, what do you feel will create that trust that is missing in technology for now?
I want to comment on one thing, Rahendra, sure, because you're right. Trust and engagement is so critically important. I was, prior to being at CGFNS International, I was the World Health Organization, actually during the pandemic. And there was a lot of vaccine hesitancy around the world. A lot of individuals don't trust the treatments that are out there, the vaccines that will prevent the spread of infectious disease and pandemics that are cropping up. This is a real challenge that we have. It's not just around, digital health. It's around the entire value chain that we see across the healthcare system, because as it was said earlier, healthcare is very contextual and highly personal. And these are the things that we have to focus on. And to your point earlier, AI really understands us in a lot of ways that maybe other humans might not. And what Debbie was saying around sexual and reproductive health issues, where teenagers might feel more comfortable, less judged by talking to a bot. So these are really important issues that happen, but you can't just make these blanketed statements around the world, because there are a lot of different cultural nuances. Over.
Thank you. Zo?
Yeah, Rajenji. So about the issue of trust, I feel in the context of communities where doctors are not available at all, so in that vacuum, of course, any solution would be taken very spontaneously by the patients. But as far as systems where people are used to doctors, if you're able to emphasize the advantages of technology in which they're already seeing, like in India, there used to be next day deliveries used to be considered very fast, and now we have same day deliveries and even 10-minute hyper fast deliveries. So there's this convenience that consumers are getting used to, and if you see patients as the consumers in the healthcare system, then eventually they're going to demand that same kind of convenience in healthcare as well. Along with that, of course, they would also want high quality. For high quality, they would want to spend more time with doctors. They would want more, counseling and coaching. But of course, since that's not physically possible, then the next best thing would be technology. And technology can actually build more trust because it's capable of counseling and coaching patients in a much more personalized manner, as we already discussed. But more importantly, it comes with the added advantage of being potentially very transparent about where they're getting the information from, why they're recommending a specific course of treatment, why they have concluded a specific diagnosis. So the technology can actually explain all of that much more better than any of our overworked healthcare workers can. And it can also provide the evidence-based data to support their recommendations. And I'll just stop right here. Just one more point. Lifelong learning. Even if we train our doctors, our nurses, healthcare workers to be very good at lifelong learning, we can't expect them to absorb the huge oceans of knowledge that is being created continuously in the medical science sector. Whereas AI can, effortlessly absorb all of that, assimilate it, and always be up to date with the latest evidence.
Thank you, Zo. And the question is very important, that how do we maintain the quality without compromise? I was on the accreditation committee of the Government of India for hospitals, and of course we used to still accredit on the same parameters of number of doctors to bed, nurses to bed, and what we do, but there was no objective parameters. So in technology, at least I can say for sure that you will be having a digital footprint of all that you do. So I can see exactly at what readings did the patient enter the system, when did they exit, and when did it get readmitted. So maybe we would redefine what are the parameters of quality. In an AI system, I think the number of hallucinations per patient's life journey would be an important quality yardstick. And to me, if you ask me, I am not saying I'm over excited about it, but I believe that technology will be able to manage quality better than the conventional care delivery model, because it tracks everything in the process. Everything you do has a digital footprint. I will definitely ask my colleague Dr. May what she feels about it.
Yeah, I completely agree, Rajendra. And this kind of reminds me of the empathy point that we brought up a little bit earlier, which is I want to mention that one of the projects that we're working on is with First Nations. And First Nations have an issue with the way the medical system is set up in Canada, for example, because you can only go to the doctor with one issue. But the way their culture is, when you go in, you need to talk about the full picture, and they have multiple things that they talk about. It's just a very cultural thing. And this is something that can be completely taken care of with AI, with an AI-based system, right? So I completely agree with you that this is this can completely be helpful in this regard, and develop that trust with with populations who normally would avoid going to doctors, which creates, like I know in Canada, that creates big problems because it means that conditions get worse and manifest into something serious, and it costs the system in terms of, not just dollar value, but also societal impact and cost lives.
May I remember in one of the books I wrote that in one of the provinces in Canada, they run a lottery to be attended by doctors. Lottery system, by doctors. So if that's the seriousness, it's really tough for me to ignore not giving technology to such populations. Mavish, from a patient standpoint, how would you see quality in technology versus a conventional doctor?
So if you see, I feel patients would be more happy to get time from a doctor, but a doctor should be able to understand my condition well. My history, he should know my history. And if I don't get that much time, how will I trust the doctor? But if I go to AI and I say, okay, these are my symptoms, and what best options or what treatment you can provide me, I would get better outcomes from that, because it has, as you said, it has a complete standard operating protocols and the treatment guidelines from where it can take out the data, collate it, and share it with me. So I would trust the AI more than a doctor.
Debbie, what's your take on the quality that we're talking of in the technology age?
I absolutely believe that quality from a technology perspective could be better than individuals, and in many cases has been. One thing I do just want to point out is that we need to be very careful of technology increasing the digital divide. For example, LLMs at the moment are primarily trained on Western culture, medicine, languages, intonations, cultural context. And that is not going to be appropriate for rolling out in Rwanda, for example. And we need to spend a lot more time ensuring that the quality is not just high quality for certain communities, but high quality for all communities, particularly those who are underrepresented at the moment. So while I think that it's possible that it will get to that point, I think we need to be conscious in how we are approaching improving quality within these things to ensure that we do it in an equitable way.
Thank you, Debbie, so much. We have a question from the audience. Please tell about yourself and ask the question.
Can you hear me? Yes. Okay. My name is Melody Musoni. I work for a think tank called ECDPM. So I'm the medical field at all, but I was happy with the conversation that we were having here, and I learned a lot. I guess mine are more of concerns, and I think Debbie, you have already touched on one issue when it comes to digital divide, because my fear is the more we digitalize the healthcare system, we are going to leave so many people behind. Even just to give the Mom Connect example that Debbie was demonstrating and showcasing, you have to have a phone for you to be able to register and to use it. And if you don't have that phone already, you're automatically excluded. So I think as we start thinking more about how we are incorporating AI in digital healthcare, we also need to bear in mind the issues of digital divide and marginalization. That's the first point I wanted to make. And then the second point I also wanted to make is perhaps we also need to think about the option of opting in to a digitalized service and opting out, because I think you mentioned, the other speaker, about the importance of human to human interactions. Personally, I think I would still want to go to a human doctor if I have the opportunity to do so, instead of relying on a technology. So I think as we are advancing in our innovation on healthcare, we also need to make room for people who may still want to have access to physical doctors or real doctors. And the third point I also wanted to mention, I think the speaker online kind of touched on it. I think now with generative AI, there's a lot of misinformation and fake news that is flying, especially around fad diets. So people, I know, especially they use Oprah a lot, and they have generated so many videos where they'll be like, Oprah, you think it's Oprah, we saying, I was using this product and after using it in 2 months, I lost weight. And a lot of people are falling for that misinformation, and a lot of people are buying these products. So I think we also need to find ways in which we can address the issues of misinformation and fake news. And I think the example you gave about patients going to doctors and requesting for a certain medication and the doctor is not aware is a good example of that, because they are seeing all these things on social media and they expect all doctors to know. So there should be a way in which we address issues on fake information, especially around use of certain healthcare services, for example. And I'll stop there. Thank you. I think he also had a question.
Yeah, very important points raised. And I think this is what Peter and others were alluding to, that while we get to implement technology at scale, we should be careful about the don'ts more than do's, because that's something that we need as frameworks to implement. Yes, you have a question.
Can you hear me?
Yes.
Yeah, so more than a question, I think it's just some comments I had. I had written it down so that I don't forget it. But I think an important point that we missed upon was basically how doctors are limited. That has been addressed, of course. But compute is growing at a larger scale than ever. So it was Moore's law before, where it was, it grows 2 times every 2 years. Now it's 4 times and the cost is going down with GPUs and, multiple compute systems. And at the same time, you have compute systems that can run AI models on a system that is as cheap as $20, but give you an accurate response in 6 seconds. So this has been, still not been implemented, and I think this would help a lot of places where you need instant care. And the compute cost is a lot for running these large models. So I see them as superpowers. And also touching upon the point of the empathy that we discussed, I remember the movie WALL-E. I'm not sure if everyone has watched it, but basically, they learned everything from what they saw. So I think empathy is a social model, because now what you see is what you believe in. So if you start seeing an AI doctor, you won't probably go to a normal doctor eventually thinking, oh, I think that's a human, that won't be as accurate as an AI, although that's very dystopian. But I think that's just how it comes to be, with new technologies. And one interesting point that I noted, Mr. Zoh, you said that you addressed ChatGPT as him. Now, we have started, addressing AI models as a person instead of, just being on the cloud or somewhere else. So that's something that we've already started doing, and it's in the matter of 2 years. So I think, that's something we need to consider as well. Yeah, that's it.
Thank you so much. It's a very important point, that, and I keep concluding, with the way world is changing, that this is not a technology change. It's a societal change. Society is changing. Don't think that we need to adopt technology. The society has already adopted technology. We are all learning without barriers. Today, a teacher is not the main custodian of the information to deliver to the student. It's a YouTube. Any lecture you want on any topic you want, you can go and watch. Same way, patients watch Instagram. They go and ask their doctors, hey, I looked at a star. I saw actually India's world's top cricketer talking about a CGM. Why would someone believe their doctor? They would believe the best batsman who is like an icon, a role model, talking that I use CGM, my sugar is controlled. Now tell me, who is making a choice? We used to say in healthcare, doctor is the customer and patient is the consumer. Now technology is changing that role and relationship from customer to consumer directly, which was never thought of for centuries. It was doctor who decided. Now today, as a patient, I know more about my treatment than my doctor knows. I mean, it's a real experience I'm telling you. Being in healthcare, being an advisor to my health minister of my country, my doctor didn't know about digital therapeutics. I decided not to go to her. She was a young doctor. I mean, very experienced, very famous, known for controlling, but she didn't know. When I used a CGM, I was told, showed the readings. I said, why do I show to her? She didn't prescribe me. You will have patients like me too. I mean, you'll have patients who will believe the doctor. So all kind of things will exist. But I think it's a big societal change. Now, this brings me to I would still take one online question, Sakshi it is, before I want to go back to my panelist again based on what we have discussed.
Sure. So the next question is, how can we ensure the accessibility of digital tools in rural areas?
Okay. I think I would go to Debbie first.
So there are a lot of things that we still need to address from an infrastructural perspective and from a cost perspective in order to ensure that digital health can be used in rural areas. Just the fact that, what the previous audience member mentioned, that even Mom Connect, you have to have a phone. There are still major barriers to access to digital health technology. These include things like electricity. If there's no electricity where you can charge a device, you're not going to be able to have a digital health solution. If you don't have any mobile penetration in that area, it's going to be very challenging. You can do offline, but it's very challenging. The other thing from a cost perspective, just thinking about AI, for example, we on Mom Connect, it's 20 cents per user, 20 US cents per user per year to run the program. If we were to shift that completely over to generative AI, it would be $10.20. So the cost at the moment, and I hear the other previous audience member around the cost of compute going down, the cost at the moment is also prohibitive for a lot of these technologies. Things will go down, access to various things like electricity will go up, but we have to be more conscious about this in ensuring that those who need the services most are not left behind, because unfortunately just market forces alone have not actually solved all of these problems.
And bringing this point of cost of technology, I mean, of course, not what I'm saying may apply now, but when cell phone came in, at least in my country, I used to pay a very heavy cost of called airtime and cell phone usage. Today, you only pay for data, you don't pay for calls. It's free. We're the cheapest data. So I think technology, not only the computing power goes up, the cost goes down, but I think you have raised an important point of the digital divide. Within the IGF, I also lead 3 dynamic coalitions. So one of the goals that I'm putting to my overall 31 dynamic coalitions is that still 2.7 billion people are not connected to the internet. That means 1 out of 3rd person on this planet has no access to internet. We are very privileged people to be talking about all these things. And we should always understand that we are privileged. And that's what we are supposed to deliver in these forums, is talk the real issues and not ignore anything that matters. So I totally understand what you're saying is very important. And as IGF community, which is responsible for putting its views to the UN on these matters, this is a very important point, given that health is a determinant for living. It's not something that is a choice that you should have. It's a right. Health is a right, and technology makes that right possible. So that being said, I would move this to Peter. Peter, you're working in Rwanda and now Ghana. What is your take on this?
Yeah, I think what has been said, I would close by saying, look, technology, it's exciting. It's a new horizon of opportunity, but we have to be conscious of the unintended consequences, the ethical dilemmas, the digital divide issues, the challenges that we continue to see worldwide as we're looking at governments around the world taking money from health education and welfare into defense spending. We're seeing a sweeping shift in looking at isolationism, and that will be a challenge if we think about not just the health worker being mobile, the work is becoming mobile. So it's going to really democratize, in many ways, opportunity for access to good care. If we pay attention to the digital divide discussion that was talked about.
And here I would, go back to all my panelists on a very important point. I have seen all the discussion that you all made, and very important, relevant point, including questions from the audience. what came out is that technology is going to move from a doctor-dependent model to a non-doctor-dependent model. It could be any clinician, it could be a non-clinician, it could be a citizen doctor. But having said that, when all of us agree on a few points, cost is going to come down because of technology. It's going to be convenient. You can have it when you want. It's going to have better engagement, better empathy, better quality, a better experience, and a better repository of knowledge. My question to each of my panelists is to justify why will technology not replace a doctor? I mean, starting with Dr. Peter Petriosi, please.
Yeah, I think the human touch is critically important. I think that we're going to find, so many other types of technologies. Looking at precision medicine, I'll just bring that up as well. We haven't talked about really treating people at the molecular level, the cellular level, which is going to transform care delivery. And again, looking at the divide that exists between those higher resource countries to the lower resource countries, and how do we begin to democratize that? So, I think that I think that having the future health professional will succeed and evolve with technology, not without it. Those will be the individuals and the patients that will be able to succeed and to do much better in the world.
Thank you, Peter. Mavish, from the patient standpoint, will technology replace doctors?
If you see, it's been years for me that I've gone to bank. So if bank is on mobile, why not AI doctor on mobile? So yes, I am for it. AI will actually help doctors to enable treatment. So yes, AI will replace doctors.
I think that AI will replace the majority of doctor visits.
So as far as the title of this panel discussion is concerned, I feel yes, AI will definitely replace PHCs first and foremost, and perhaps some of the other specialized use cases as well. But PHCs, because over there it's not actually replacing doctors. As I mean, if I were to rephrase this to make it more satiable for our healthcare workers. It's not that the technology is replacing them, rather it's making room for them to do their job more effectively. So that way I feel it's a win-win for doctors, patients, healthcare systems around the world. And one more thing that I'd like to add in that is about the regulatory standards and the need to define them with the participation of all stakeholders, particularly because one of the audience members mentioned about the risks of AI, particularly about generative AI, but I think there would be risks in other use cases as well. And over there, I would emphasize that the role of academic organizations, academies like the Academy of Digital Health Sciences or AUB, American University of Barbados, we need to make sure, and other organizations need to make sure, that we are training the next generation of doctors and our faculty members, our stalwarts, in a way that they're not cynical when it comes to technology. Because if our experts are cynical, then they might advocate for harsher standards, and that might decelerate this transition from doctor-centric healthcare to a non-doctor-centric healthcare. Thank you.
I just wanted to add that, to clarify that they will replace the majority of doctor visits, but even for the visits that they cannot replace, they need to be the AI will need to be at the table as part of that team, interdisciplinary team, and that's going to be quite important.
People will say, have you seen the AI before doctor? Yeah. Debbie, your take?
I'm going to use an example that you used of Kindle.
and how, libraries and bookstores have been replaced by the Kindle. In recent years, there's actually been a resurgence of bookstores, and there's a huge growth in that market. I personally, even though I'm a technologist, I like to read physical books because I like the way they smell and I like the way they feel. And I'm quite happy to carry around a big tome with me in order to get that advantage. And so I don't think that even if something is possible, even if it does make these things easier, I don't think we're going to replace human touch entirely. And there are definitely going to be people who prefer human touch. And it may even be that for a while we have, a drop in the number of people who are accessing doctors, but that it will resurge again when people realize the advantages that you can get from the human touch that you just cannot get from technology. So I don't believe they'll be entirely replaced. I do believe that it's going to make the lack of health workers a far smaller problem. And I do believe that it's going to be critical that AI is a part of the team, as you mentioned, May, but I don't believe it's going to replace doctors entirely, despite being a technologist.
Thank you so much, Debbie. And it was a great discussion. And every year at IGF, at Digital Health, we discuss how technology is shaping healthcare and how healthcare is shaping technology. It's both ways. I really thank Dr. Peter Preziosi for being awake late night and joining us and sharing his valuable insights, which are going to shape the way we look at health. Mrs. Ali Khan from the American University of Barbados, Dr. May Siksek, Mavish, and Debbie Rogers. Thank you all so much, and Sakshi Pandita, who's been moderating us online, and for all the panelists who joined us, all the viewers who joined us and asked those important questions. Next year, we're going to present you the findings of what AI did to healthcare. Thank you so much, and wish you a very happy holiday season, Merry Christmas, and a great year ahead. Thank you.
Goodbye. Thanks.
Thank you.
Hi everyone, apologies for the delay. I'm just trying to we need Dennis Hedeker as co-host as well.
Okay. Oh, three.
This is a good position for it.
Hello, check audio. Okay.
And the speakers, Mary Mohammed, Ana Cristina Ruelas, who are already here. They also need permission to speak and show their images, their videos.
Testing.
Thank you so much. Apologies for the delay. We are
I don't
still
feel-
waiting for Samara Castro, who is another of the speakers. But let's start with the session so we don't have any more delays. Thank you all for your patience. My name is Yasmin Kouzi. I'm a law professor at FGV Law School, the Getúlio Vargas Foundation at Rio de Janeiro, postdoctoral research associate at the Carter Institute of Democracy at the University of Virginia. The session is organized alongside my colleague Dennis Hedeker from the Dynamic Coalition on Internet Rights and Principles. It was an idea, a joint session with the CPR, the Dynamic Coalition on Platform Regulation, Platform Responsibility, sorry, which I coordinate with Professor Luca Belli as well. So as we all know, digital platforms has radically transformed how we engage with information, ideas, and each other. And with these advancements come critical challenges: the spread of disinformation, misinformation, hate speech, and threats to democracy are concerns that demand our attention. The idea of information integrity has emerged as a framework to address these issues, but it remains an evolving concept that lacks a solid, unified theoretical framework. This session today seeks to bridge this gap by exploring information integrity from the intersection of human rights and platform responsibilities. We just published the CPR outcome. It is available at the Internet Governance Forum website. I can put the link here in the chat later for any of you who have interest on this. Basically trying to explore this gap with the information integrity literature that we think that could draw more on the platform responsibilities scholarship. So we propose this session to examine the responsibility of social media platforms over online content and governmental and international strategies to ensure and uphold human rights principles. Our goal is not only to discuss the challenges, but also to evaluate and support the ongoing activities of all stakeholders involved in this debate and involved in advancing human rights and inclusion in the digital landscape. And that's the idea of our session. I hope we can all engage here. You can raise questions. We have a time for Q&A after the speaker's presentation. I'd like to thank you all again for being here. Thank you all for your patience with this little delay in starting the session. And I would like to invite my colleague, Dennis Hedeker, for his presentation as well, and presentation of the IRPC, our partner here today. Thank you so much once again.
Thank you very much, Jasmine. Thank you, everyone, for being here, the speakers, the on-site moderators, and obviously the technical team. Indeed, we this year proposed this joint session to bring together the knowledge of two dynamic coalitions, and next to the platform responsibility, the dynamic coalition that Jasmine just introduced, the Internet Rights and Principles Coalition, founded more than 20 years, more than 15 years ago, in 2009, in 2008, sorry, is a dynamic coalition that deals with today also with questions of platforms. So the Internet Rights and Principles indeed are also platform rights and principles, and the entire discourse on platform responsibilities, I would say, has taken a turn into the question of human rights as a standard for platform actions, for platform policies, and for ways of negotiating also between different jurisdictions. The Internet Rights and Principles Coalition works in this field and applies human rights standards to all kinds of digital technologies. Whereas the charter that was written about 15 years ago, it talks specifically and translates the Universal Declaration of Human Rights into the age of the internet. It definitely applies to platforms, to other kinds of technologies. And that's, I think, a fruitful engagement with these kind of documents, with the charter, with the UDHI, Universal Declaration of Human Rights, obviously, and with platform rules and platform responsibilities. So we look forward to this discussion today. Thank you for everyone to join today.
Thanks, Danny. So in the floor, we have Ramon Carlson, Tapani, Tapani Tavanyan. I don't know if they have access to their mics. We are not seeing the floor.
Okay, well, Tapani is speaking here. I certainly have access to a mic, even though I'm not on camera.
Yeah, the mic is a bit weird here.
I trust you can hear me.
Not working. Not working. Like it's a bit robotic.
Okay, maybe I'm a robot. Who knows? Okay, I'll try to be closer to the mic. Does this help? Work any better? So we have a Okay, is this better?
Yeah, it's a lot better. Thank you so much.
Okay, I just need to hold this in a specific way. So our next speaker here would be Ana Ruelas, who is working for UNESCO, leading the work on freedom of expression in the digital environment, who was formerly in Article 19 in Mexico and Central America, and is certainly very qualified to speak on these topics. So I just hand over to you, Ana.
Thank you very much. And thank you very much, Jasmine, for the invitation. It has been great following up this discussion since last year. Well, I think a little bit more, but last year we also had this conversation. And I think that it's good how it has evolved over the last year, and how good is to see a lot of people more engaging into a more, let's say, human rights-based and multi-stakeholder conversation over information integrity. Many things have happened in the last year. Primarily, I think the most important things inside of the UN is the approval of the Global Digital Compact that actually talks about the importance of enhancing information integrity and allowing people to have access to reliable information in the digital sphere. And I think that I will start with that because UNESCO started this conversation a long time ago when we released the Rome Principles and said that any kind of discussion around internet governance should be done through a human rights-based and multi-stakeholder approach. And after that, we started a huge discussion in order to try to identify how should we balance freedom of expression and access to information at the same time that we're dealing with the governance of digital platforms. And this discussion led to the guidelines for the governance of digital platforms that we believe it is a document that helps understand different stakeholder groups, how to meaningfully engage in digital platform governance, and and try to make sure that at the same time that governments fulfill their responsibilities to enable the environment for freedom of expression by refraining to shutdowns, by refraining to not being transparent about the type of requirements that they place upon digital platforms, by making sure that they are doing a step forward to close the digital divide, by ensuring journalist protection, media viability. We also have the responsibility of digital platforms to comply with 5 key principles. And those 5 key principles are very much related to what is that we should expect that should happen in order to ensure that we promote the integrity of information. The first principle relates to the responsibility for being transparent. It is not only about transparency related to how they are putting in place their operations, their community guidelines. It's also about how they are dealing with content. They have the possibility and the responsiveness for platforms to explain their users on how they are taking decisions over their content and how is that they are moderating or creating content. Also, to have the possibility to respond to users on what are the measures they are taking to ensure that while they design, deploy it, and use different products and services, they are actually being careful about the type of risks that these different products and services could entail, primarily in a specific context, for instance, in elections or during crisis and armed conflict, but also when there's a change of operations or where there's a case of to protect a specific people that are critical to enhance the freedoms in the digital sphere, such as journalists, human rights defenders, artists, scientists, etc. And the other thing that the guideline says that it's very important to create control or to create tools from the governance systems for the users and non-users to have control over their own content and make their own decisions. So this is also important because although there's a lot of actions related now to strengthen the integrity of information, I do think that it is very important that we recognize the need to create for different users, primarily the most vulnerable and marginalized users, to make sure that they can create their own content that then can create counter narratives to those that are disseminating disinformation and hate speech. And they can also take control over their engagement with the different digital services and products. The Global Digital Compact says something very important that relates to how to ensure information integrity that UNESCO is trying to move forward with, along with different stakeholders, is that multi-stakeholder networks. We acknowledge that this is not only a thing that has to happen between regulatory authorities and regulated entities, but to have also the participation of civil society actors, academics, journalists in the discussion is very, very important. So for that, UNESCO has been strengthening the possibility to have a global forum of networks of regulatory authorities engaging with a group of think tanks and research centers that would serve as a trusted interface for the implementation of the guidelines, which is very much related to what the Global Digital Compact says on the importance of integrating into this discussion those that are actually implementing the rules that are being approved by the legislative authorities. So for us right now, the main the way forward to enhance information integrity relates to creating awareness on a human rights-based and multi-stakeholder approach of digital platform governance that entails what I already said. On the other side, the strengthening of multi-stakeholder networks that acknowledge the importance of bringing together different stakeholders, not as just one role for each one, but to actually participate together in the definition and implementation and evaluation of policies. And to make sure that regulatory authorities have the specific capacities to deal with the new problems related to information integrity. So I will leave it like that, and then we can continue conversation. Thank you very much.
Okay, I'm on here. I think you can see me, Anna, but I'm here in person. Well, can you hear me? No?
I hear you, but I cannot see you. I don't know
Oh,
why.
yeah, it's gonna
I think,
be.
oh no, they showed the video now. They let me at the
Well, actually,
spotlight.
I tried turning on the video,
Yeah.
but for some reason, the Zoom say I cannot start. Can you hear me now? Okay, so
Yes.
I can hear you. Yeah.
okay, I hope you can see me following the session. But for start, I want to say thank you, especially for Yasmin for inviting me. It's a really pleasure to share this session with you, and it's really incredible. Listen, Ana Cristina Velas, she's a very important specialist that I think that have many important topics to bring to us. So let me just see here. Thank you, Ana Cristina. I think we have a very specific work from UNESCO in producing knowledge about how human rights are challenged by new technologies and the impacts on economic and social challenges. But now I have a due for ask for. I'm not listening myself well. Just can you hear me well? Okay, my microphone is
Yes, don't
just
worry.
cut my voice, and this is just. But okay, let's go. Okay, now it's better. Oh, so much better. Well, I would like to ask for Marie, one of the speakers, to she could share your contributions about the global south, please.
Thank you everyone. Hi, am I audible?
Okay.
Yes.
Yeah. Thank you so much for having me as part of this panel and for this important conversation. And I think in my intervention, I would like to talk about the limitations, some of the limitations that we feel of the dominant framing of the term information integrity and the current approaches that we have seen so far to strengthen information integrity. So, information integrity is a much discussed as well as a much contested term. Initially defined narrowly in terms of accuracy, consistency, and reliability, the concept or the term has now evolved. And now, when we look at the global UN Global Principles of Information Integrity, which was released in June, I think, of this year, we can see that the focus is no longer primarily on the integrity of the information as such, but the integrity of the information ecosystem. And this is a welcome and necessary change because many have been pointing out how the earlier framing of information integrity in terms of just accuracy, consistency, and reliability tend to neglect the broader ecosystem of actors and the economic, political, and social factors that shape the production, legitimization, dissemination, and consumption of information. So now, while we have a broader framing of information integrity now, we still need to deliberate on what it means in actual concrete terms so that it does not become another buzzword. So the UN Global Principle describe information integrity as, and even in the GDC, when you see GDC, you can see the similar language as fostering a pluralistic information space, one that enables trust, knowledge, and individual choice. And no one can dispute that these are important values to achieve. But the question is, what do they mean in practical terms? Like, what kind of pluralism are we talking about? How can we remove the barriers to exercising individual choice? What is it required to build trust in diverse contexts? So these questions demand careful consideration, especially grounded in the unique complexities and challenges faced by different regions. In other words, while it is useful to have an overarching set of principles, for any real results, these principles have to be infused with meaning by the collectivist visions of what information ecosystem should entail in each local or regional context. So, for example, the dominant, some of the discourses that we see, it simplifies information integrity to a binary of trustworthy versus untrustworthy information. The assumption that just by providing trustworthy and accurate and plural information will automatically empower citizens, ignore the complexities of communication dynamics and public trust. It also overlooks the nuanced ways in which diverse population perceive, interpret, and engage with information. So I think a meaningful articulation of information integrity must address the informational needs of the people in their regional, social, cultural context, identify the barriers that prevent them from engaging meaningfully, and ensure their ability to participate in public deliberations. So the dominant framing of information integrity, which focuses primarily on supply side of the information, that is ensuring accuracy, reliability, trustworthiness, it can be inadequate. The information integrity debate should also grapple with individuals' ability to generate ideas and opinions, express and speak, and most importantly, have their voices heard and understood. Because in many regions, there are populations who have faced criminalization and censorship, and they have and as a result, they have had limited opportunity to produce information. Now, another point that I want to raise is the limitations of some of the limitations of the current dominant approaches to strengthening information integrity. The UN Global Principles on Information Integrity may have adopted a broader framing of the concept, yet the recommended responses do not seem promising enough to bring forth the structural changes in the information ecosystem, as it relies heavily on state-based regulations and goodwill and voluntary goodwill of technology companies. It's true that the approaches, the measures, platform regulation measures like fact checking, improving content moderation, platform transparency, these are very important and crucial and must be implemented with great vigor. And can go a long way in improving the aspects of information ecosystem. However, they tend to be symptomatic remedies in the sense of mitigating harms. They operate within the confines of the surveillance capitalist paradigm, ultimately reinforcing big tech's gatekeeping power without addressing the underlying structural issues. So these measures have to be accompanied with some structural reforms also. Further, even when we talk about measures to enhance competition among digital platforms and services, such as by mandating interoperability and data portability, these are significant. They should be carried forward. But even these measures, I am not sure if they guarantee a shift away from the extractive surveillance-oriented, mode of curating conversations that we have now. Even measures to give users more control over the content that they view. I'm not sure how successful that will be given the polarized environment where entrenched platform designs make it challenging to exercise meaningful choice even for tech-savvy users. So I'm not sure if there was a major section of the population who may not have digital literacy and may struggle to make such meaningful technological choices, and they still rely on messaging apps like WhatsApp to get basic information or to even get welfare services. So the user empowerment measures, I'm not sure how much successful it will be to to safeguard the information integrity, to strengthen information integrity. So the liberal regulatory playbook of supplier-focused and consumer-focused remedies to restoring health and vibrancy of the public sphere does not address the root cause of the problem, which is the business model of the platforms, the techno-design architecture that foster the hostile digital environment. So challenging this paradigm needs structural changes to social media platform architecture and not just procedural rules to mitigate specific harms. So we must reimagine how public discourse is organized online, placing values of truth and democratic integrity at the center. But yet these values of truth and democratic integrity seems incompatible with the surveillance capitalist model that we follow today. So hence, to safeguard information integrity, it is vital to make a shift away from the extractive business model of online platforms. Even the UN Global Principles acknowledge this imperative, but stop short of mandating real action, leaving it to platforms' voluntary reevaluation of their models. This is insufficient. We need structural reforms we need legislations to enforce these structural reforms through legal and policy measures. And there have been many suggestions of how such structural reforms can be brought about. So these measures could include imposing a statutory duty of care on platform owners for addressing the individual and societal harm stemming from their business model. Some even suggest a call for, ex-ante licensing of platforms akin to pharmaceutical drugs, given their societal impact. Regulations could also target platforms' reliance on attention-driven algorithms. So instead of prioritizing just relevance, platforms should be required by law to promote diverse, serendipitous, value-sensitive content tailored to different contexts. Regulations could even, I mean, it could even require platforms to change their structures from profit-seeking to non-profit model. I mean, so we need such bold solutions, I think, to really strike at the root cause of the problem. And beyond regulating big tech, there are other measures that we should also think about, like fostering diverse alternative media and communication platforms. There's a strong case to be made for public service media, community-driven initiatives with a civic mission to provide citizens with a pluralistic global view of the world. And this would require public funding and policy support. Then reviving journalism, local journalism, but is very important. It's essential for combating disinformation, informing public deliberation, and to restore trust in the community. The government can play a role in this by providing sustained financial support, implementing revenue sharing models between platforms and news publishers. And journalism, the media also should think about alternative business models to ensure their independence and survival in this changed landscape. So, to conclude, I would just like to say that addressing the chaos in today's information landscape demands structural reforms that target platform business models, the incentive structure, the techno design architecture. And along with that, we need measures which would, we should have a positive vision of what an information ecosystem should look like, and take measures which would create incentives for truth and public deliberation, which will satisfy the information needs of the people and remove the barriers that people face in meaningfully engaging with the information that they receive to respond to the information. Yeah, that's all. Thank you.
Thank you, Marine. That was a very eloquent presentation of the root cause of the problem and even some good ideas on how to do that. Although the one thing that you are still missing is how to find the political will to do that. But of course, talking here is one way to push exactly that. So maybe there is hope. I will not delve more into that. But next, we're supposed to have Samara Castro, but I understand she's not present. But somebody from her office is. Is that correct?
Yes.
Yes.
Yes, it's Mayra Sato.
Okay, Mara, please go on.
Hi, hello. I don't know if you can hear me properly.
We can hear you.
Yes, we
Okay.
just do not see you, right?
I cannot open my camera. I don't know why. They say that the host has closed it. I'm not sure
Yeah,
if I
I
can.
cannot habilitate it either.
But if you can hear me, I think this is the most important thing, right?
Yes, but Ramon, maybe can you talk with someone in person there to ask if they can
Yes.
turn on
Just a minute.
Mara's camera? Thank you so much. I'm sorry, Mara.
No problem. Don't worry.
Well, at least we're not having Zoom bombings. We had tons of them in 2021. The technical issues at least are minor this year. Did it work? Well, Mara, I think you can start and then they can solve it later. Thank you so much for your patience.
Oh, yes. I was having a problem to open my mic too. Again, well, thank you. Good morning. Thank you very much for inviting Brazil to take part in this debate. As I said, I'm actually replacing our director for freedom of speech, Samara. She had a last-minute incident and could not join us here today. I didn't have much time to prepare my intervention here, but I hope I can contribute to the debate. Well, first of all, I'd like to say that my institution, the Secretariat for Digital Policies of the Presidency of the Republic, is a new structure in the Brazilian government. And it was built in Lula's government when it became very clear for us that we needed to have a digital policy to deal with the issues of disinformation, misinformation, and all the new challenges that the digital environment imposed to the information ecosystems. We had, as you may know, several important cases of disinformation that had a severe impact in the elections, threatening our democracy and also our policies, including health policies, for example, during the COVID-19 pandemic, when the spread of anti-vax disinformation affected our health policies and vaccination levels. So our secretariat started its work focused on fighting disinformation. Our government established by decree the Procuratorate for the Defense of Democracy, and we designed institutional channels to ensure that the information and analysis of cases of disinformation that threaten the democratic system and the implementation of federal policies would be duly followed by the governmental institutions responsible for that. But besides doing its work in monitoring and informing the relevant institutions on cases of disinformation, our secretariat also started some innovative programs. We actually considered to be a kind of pilot to create and test new approaches to deal with disinformation applied to concrete sectors. So first of all, we decided that we would focus our attention in the health sector, considering the serious impact that disinformation had to the decrease of the vaccination levels in Brazil. And just as an example, in 2021, we reached the lowest levels of vaccination in Brazil in decades, and similar to what we had in the 80s, for example. And this program that we launched, called Health with Science, was launched 1 year ago and is supporting our Ministry of Health to recover the levels of vaccination in Brazil. The program acts through several pillars of action: monitoring of disinformation narratives, communication strategies, investigation and accountability, institutional partnerships, and capacity building. So it aims to promote an integrated approach to deal with disinformation. And in parallel, our secretariat was also actively contributing to the international debate on information integrity. This is because we understood that the concept of information integrity allows us to have a positive and propositive approach to deal with the new digital information ecosystem and the challenges that it imposes to the public debate. And we understand that this is essential to the functioning of democracies and the right of access to reliable, accurate, and evidence-based information. So with this understanding that information integrity was the concept that allowed us to have a propositive and integrated approach to the new environment, digital information environment, Brazil has been very active to include this concept nationally and internationally in the debate. So, as Brazil was in the presidency of the G20 this year, actually, until November, we worked to include this issue, the issue of information integrity, in the G20's agenda, and we managed to include an item on information integrity in the G20's working group on digital economy. That was the first time that the G20 countries committed to act to promote information integrity in the digital space. So we think it's an important step. We also contributed to the discussions on information integrity in New York during the negotiations of the Global Digital Compact, and we were happy to include a separate section on information integrity in the GDC. Recently, very recently, actually this week, we also adhered to the OECD recommendation on information integrity. And now in the G20 summit last November, we officially launched with the United Nations and UNESCO the Global Initiative for the Information Integrity on Climate Change. The idea, again, is to focus our attention on how to implement this concept, how to operationalize this concept in a specific sector, which is not so specific, so specialized, because of course it involves the whole society, but in any case is a concrete implementation of the concept. This is our aim. And the idea of this initiative is to join forces between governments, international organizations, and civil society organizations to promote the information integrity on climate change through a global fund to be managed by UNESCO. The fund will support research projects, strategic communication projects, and reinforce existing communication campaigns. The initiative also aims at promoting the debate on information integrity at the institutional level and in the international agenda, including the Conference of Parties of the UNFCCC. And we are now preparing to launch the Brazilian chapter of the Global Initiative. The Brazilian chapter will be our national implementation of the Global Initiative and for information integrity on climate change. And our intention is to create, through the experience that we have achieved with our Health with Science program, also an integrated approach and to promote information integrity on climate change and talking with different actors, including the civil society and mobilizing the private sector to be a very inclusive process, and the government, of course. And to be faithful to the concept of information integrity as defined in the UN's global principles on information integrity, we wish to adopt a broad perspective and focus our attention in different elements that support information integrity, while understanding that regulation matters need to be treated a bit separately, as they don't depend exclusively on the executive power of the federal government. In this context, we are focusing our attention to areas such as research, communication strategy, accountability, support to journalism, also media and environmental education, and positive incentives for information integrity. In this last pillar, we also wish to work with, to foster a national coalition of advertisers for the information integrity, which is something I think it's very important because it also deals with some of the structural issues of how advertising and publicity works in the digital space. But it is also important to mention that even though in the Brazilian chapter of the Global Initiative, we are not focusing our attention in regulation.
I think Myra is offline right now. Something happened with her connection, maybe. Yeah, Myra?
The sound. I think the mic.
Oh, okay.
Off
the mic.
again.
Okay. Okay.
Sorry.
Sorry about this.
So, no problem. So I was also, I was just saying that even though our actions here in the executive power, they are not focused primarily in regulation, because we know that regulation depends on on other powers of the government, which are not in our power to decide. We are trying to have an active participation also in the discussions on regulation that are taking place in Brazil's Congress, National Congress. When recently we had an important approval by our Senate of our law on artificial intelligence. This law is not finally approved because it still needs to be approved by the Chamber of Deputies, but it's an important document in which we managed to establish a governance for AI systems with a regulatory agency according to a scale of AI systems categorized by levels of risks, and with a special focus on human rights and with the different due diligence responsibilities. And we also managed to ensure that the use of works subject to the rights of author to train AI systems will be paid by to the right owners. And moreover, we managed to include also the term information integrity in the text. We're trying also to foster this debate on information integrity here nationally. So in all these actions, our aim is to promote and to develop the concept of information integrity nationally and internationally, and to test different approaches on how to concretely operationalize it as a public policy. So I think that's it, what I had to say here. Thank you.
Oh, hello. Can you hear me well? Oh, now I think you can see me too. Oh, okay, that's good. Well, thank you, Maida. You have a really hard job, it's in a very short time, but you were just brilliant. So thank you so much for this. And well, I took some notes regarding the Maida speech, and I would like to read this because, well, I realize some things now. We are competing against lunchtime, and this is so unfair. Technical problems too. So, thank you for your patents, and I would like to say that it's a pleasure listening to you
I'm
and
sorry,
contributions.
your mic is cutting off a bit.
Yes, it is.
I don't know what's
Now-
happening.
Yes, now it's
Someone is
better.
sabotaging our session.
It's better now, Yasmin? It's better now?
Yes, it's a bit better. Yes,
Okay,
thank you
I'm so
much.
sorry for this, guys, but well, I'm trying to read my notes about regarding the Maida speech. Well, the G20's Digital Economy Working Group that Maida mentioned it under Brazil's.
Now you're totally muted. Maybe
Okay.
the battery of the microphone is off.
Okay, just a minute.
Yeah.
Okay. Now it's better.
Nothing.
Um,
Not a word.
No. Okay. I think the problem is that I need to hold so tight the mic. This now it's okay?
I think the room's mic
It's
is
not-
off. I mean, I
Oh
think
yeah,
you
the
can
room's
unmute.
mic is off. Now maybe we can. No,
Yes.
nothing. Nothing as
Okay,
well.
now
Oh,
we can-
okay. Now it's better. Now it's better.
Okay. Now can you hear me? Now can you hear me? Oh, okay. No, okay.
Yes, yes, yes.
So I think it's really terrible to me. I mean, just I need to turn it off the phone because it's better to talk. It's really cutting, but I think you can hear me well now, right? Okay, so I can hear you, but I'm gonna read some points that I note when Maida were talking. So the G20's Digital Economy Working Group under Brazil's president achieved a landmark consensus of promoting information integrity. Well, we have for the first time a multilateral declaration addressing this crucial issue, highlighting its impact on political and economic stability. For key areas were identified: significant connectivity, digital governance, artificial intelligence, and information integrity, the central theme of your session. Brazil champions a comprehensive approach, balancing rights and promoting transparency through initiatives like Brazil Against Fake News and Comunica BR. The G20's acknowledgement of the far-reaching effects of disinformation and hate speech underscores the significance of this achievement, paving the way for global cooperation to combat misinformation and force a resilient information ecosystem. So this is some points that I write when Maida was speaking, because I think we have a really good experience in Brazil with G20, and I think Maida, is very important to have you here to share this contribution with us. So thank you so much. But now I'd like to ask Professor Yasmin Kurzi to share her contributions. I admire Yasmin's work very much. I heard her article this week, Gender Information Integrity, and that's really good. And Yasmin, please, the floor is yours.
Thank you so much, Hamon. So the article that Hamon mentioned, it was an invitation by the IT for Change. Thank you so much, Mary, for inviting me to contribute to Vote Populi. I'm putting the link here for any of you who have interest in also following this discussion. But what we are proposing, the idea of this article that Mary invited me to contribute with, was discussing information integrity through a gender approach, through the gender dimension within information integrity. Basically, what I'm trying to link here is how feminist scholarship can contribute to the debate on platform responsibilities and information integrity. Some lessons that the feminist scholarship could actually be used to be utilized to inform policy making on information integrity. I'm being really brief here because I think we still need to have time for Dennis to speak and also to have the Q&A. But basically, the idea here of this feminist approach to information integrity is basically two proposals that I think that are central here. Is the feminist scholarship, we have really to address inequity, to address inequality in the roots of the cause. So as Mary's presentation highlighted, we have structural issues regarding information integrity that relates specifically with the media pluralism ecosystem, the lack of media pluralism in the informational ecosystem, and the power dynamics that are unequal, not only in Brazil, but in all the countries, actually. We need policies to actually decentralize media monopoly. I'm not only talking about the big techs and specifically, but also media in general, the TV channels and etc. We need actions and policy making to enable, to foster media diversity in this sense. And another lesson from the feminist theory, from the feminist scholarship that could also help to inform the information integrity debate is to enable more participation in this spaces, enable more participation from local and regional initiatives to actually bridge this, to bring more diversity, not only to the policy making, this participation processes, but also to content producing and to moderation. And another thing that feminist theories, feminist activists and scholars have been highlighting, platforms need to open themselves to actually learn with the experiences and the research that feminist scholars and activists have been producing. Civil society has been producing reports showcasing how online harassment, and coordinated campaigns have been targeting specifically women and LGBTQ plus individuals who have positions that break the status quo, that dispute the status quo, and this impacts significantly the democracy and political participation of minorities. So to address this, they need to improve their content moderation policies. It is a discussion and a point that has been highlighted within the platform responsibilities literature for a long time. But again, as Mary, as Anna Cristina, and the other speakers have been highlighting here, we need to address platforms monopoly. We need to try to talk to these actors and actually make them engage more with human rights in an active stance, and not only promoting truth in the internet, but also tackling how the algorithmic ecosystem, how the algorithm content recommendation systems actually promote hate speech, but it relates to the economy attention, relates to how they profit over this. So we need to actually look at the root of the problem to be able to create efficient solutions in this. These were the ideas that I tried to highlight in this article. Thank you for your time and patience here. I will pass the floor now to Dennis Hedeker so he can also speak about his research. Thank you so much.
Thank you, Yasmin, and thank you, everyone. This was already a fantastic discussion, and I really appreciate the different perspectives that we bring together here in this session. I think this is the spirit of the IGF, right? This is the multi-stakeholder perspectives, and we just heard with Yasmin, some researchers' perspectives too. Let me share some research that is very fitting to this topic. Conducted at the University of Bremen. So I have a bit of my academic hat on here in addition to, yes, I think this is in addition to my hat as the co-chair of the Internet Rights and Principles Coalition. Can you see the slides of my presentation?
Yes.
I wanted to provide a perspective from a recent 41 country comparative study that we conducted, asking people about their attitudes toward social media platforms. And a number of questions relate very directly, I think, to the question of information integrity, even though the discourse on information integrity that has now become a global discourse. And thank you so much for Brazil and others and UNESCO to championing these efforts, also on the state and interstate level. The research was done in 41 countries, as I said, mostly in the global south and Eastern Europe. Was conducted at the University of Bremen, and the method was essentially web-based online survey with a survey questionnaire in 6 languages in the end of 2022 and until early 2023. The sample includes about 17,500 people from these countries. Some samples are a little bit better, some are not as great. We can talk about that. But that's just as a background. What have the respondents, so those users of Facebook and Instagram, responded to when I asked them to what extent misinformation is a concern to them? It's one of the questions I had. And I can tell one thing. This is a scale from 1 to 5, and the average is it's quite high with almost 4. So quite a number of people are concerned about misinformation around the world, but it differs according to where you are and which country you live, and I think differs by a number of other characteristics too. Why is this important? Is because we often see this debate on information integrity. I think it's a global one, it's a very important one, but it applies perhaps in different nuances to different places, to different people. We've just heard the feminist lens there.
But there's some bad disturbance in your sound now. Right now. I'm not sure where it's coming from, but it looks like it's your mic or something, because it seems, at least we here are hearing very much background noise, as it were.
Yeah, there's no background noise here, but I can speak a little bit closer, and if you can speak up.
Now it's gone actually. It's pretty good.
Okay.
So keep closer to the mic. I guess that's the.
All right, I'll do that. No, it's already the computer. So, the comparison here from the survey analyzing by country, we see that, for example, people in Poland have most concern for misinformation, whereas people in Haiti have the least concern. There's a bit of, I think, a global north-south tendency here, but it's not perfect by far. Switzerland, the only Western European country in the sample, somewhere in the middle. And we do have countries from Sub-Saharan Africa on top of the list, including Ghana and Nigeria. Misinformation is the one thing, but the other thing, obviously, is, and that's a question that we wanted to bring in as the Internet Rights and Principles Coalition, is to what extent human rights are now better protected in the times of social media. And so one question that I asked was whether people thought that since the advent of social media, the following 5 human rights have been better or worse protected. So has the protection of human rights, in other words, decreased, increased, or remained the same? And you see the legend on the right. Again, this is with 70,500 people in a questionnaire. And what we can see here, and that's, I think, quite interesting, is that, and we have to remember that perhaps, in spite of hate speech and misinformation, the internet is a force to help to protect the human right to information, access to information. People say, a large majority, that it has increased the protection of that right. The protection of the right to freedom of expression has increased. 2/3 say that. There's some people who say it decreased. There's some people who say that stayed the same. Equality, it's interesting, and that relates perhaps to Marin's talk also, coming with a social justice perspective. What does it mean for equality that we have these social media platforms? It's a split a little bit here. So some increase, some decrease, but most people say it's the same or has remained the same. Life and liberty, there's also quite a number of people, about 1/3, who say since the advent of social media, that protection of that right has decreased. And I think if we think about hate speech specifically, that might actually be one of the drivers of that. There's also strong correlation between that answer and a concern for hate speech by those respondents. I don't have that data with me now. But I think also strikingly and not surprisingly, the right to privacy is seen by those respondents in those 41 countries to have decreased overwhelmingly, and only some people think that social media has actually increased that protection of that right, or it remained the same. Yeah, these are just some insights from a survey that hopefully also helps us to contextualize and helps us to, on the one hand, in a way, see, at least in this slide, I would say that some of the rights, particularly the right to information, freedom of expression, obviously seem to have increased from a human rights perspective. That's positive. But people have concerns, not just about hate speech, but as I have demonstrated, also a high level of concerns about misinformation. And I think this is something that also the survey shows, is that all governments and other actors need to work together on this to realize information integrity across all levels and in all countries. Thank you.
Thank you, Dennis. I don't think we have any prepared speeches left, so should we switch to questions from the audience? Anybody in the room?
I think we have
Remote
questions online as well.
Can you read them?
Yep, just a minute. I'm muting the
Hi,
online
everyone.
moderator.
Are you able to hear me well? Hi, can you hear me?
Yes.
Okay, so thanks everyone for Everyone's speech was very rich. I speak from Brazil. My name is Julia. I'm a researcher at the Getúlio Vargas Foundation. And I have a question for everyone. It's regarding 2024 municipal elections. Since we're witnessing the rise of influencers across various domains, such as politics, wars, and even in institutional roles, like law enforcement, which are integrating social media into their work, I was wondering about, of course, in my perspective from the Brazilian municipal elections, but also I would like to hear everyone's call on that. Because there was a noticeable lack of platform responsibility and accountability in moderating harmful content. Here, specifically including criminally targeting opponents' reputation, for example, and this highlights how critical moments elections can be and remains a major challenge in the digital age. So I would like to hear everyone's call, if possible. On that given content, how do you assess the performance of social media platforms during the 2024 municipal elections globally? What are the most unacceptable outcomes that you wouldn't like to see repeated in the future of electoral processes? And finally, what do you think are the civil society's roles in ensuring those unacceptable outcomes are identified, addressed, and taken seriously by platforms? Thank you very much.
So who wants to take on that?
Yes, I can talk a little bit as I'm here from Brazil also. Yes, we had some incidents in Brazil that were very serious and very damaging to the elections. Just one day before the municipal elections, for example, in São Paulo, we had an influencer who was like spreading misinformation regarding the main opponent. And also in the second round, we had this too. This is a problem that is a structural problem we are dealing with in Brazil. And I think, as we mentioned here, we need to have accountability and we need to have transparency on how, and we have to regulate how social platforms deal with this kind of content. In Brazil, we think that the main issue is to approve the laws that we are discussing in the Congress, and now they are paralyzed, unfortunately. But the government has been trying to address the issue how it can, you know, even without the regulation being approved yet. Our elections court is trying to launch some other regulations and normatives to deal with this kind of thing. But this is a challenge that we really need to address properly in a structural manner. And I think the civil society is very important, actually, in all the moments since 2022, actually, when we also had widespread disinformation during the elections and also in 2018. I think the pressure that the civil society makes is very important also to ensure that governments try to deal with this in a structural and effective manner. So this is an ongoing discussion still. We are trying to, on the one hand, negotiate and talk to the platforms and try to ensure that they apply their own moderation rules. But also, I think we need to advance in the discussion on regulation, actually.
Thank you so much, Mayra. I think we have one more question. I don't know if any of you wanted to address this question as well. Oh. Go ahead, Denise. You start.
Thank you. It's just a way of also integrating, obviously, different sessions here at the IGF. Yesterday, we had there was a workshop on the question of AI and disinformation during elections. And so your question is so very much valued, and that spoke to that conversation that we had. A researcher from Oxford University, Roxana Radu, brought up the case of the Romanian elections that took place recently, and that in fact a court canceled the results of the presidential elections due to the apparent benefiting of one candidate by a major social media platform. And so the question of transparency is quite acute. The question around information integrity around elections is very important. And this debate that we had illustrated this and illustrated all the challenges that we have with regard to information integrity. And it would be much better, obviously, to have solutions in place beforehand so that elections can take place uninhibited by this, rather than having to cancel them afterward. Obviously, that's a very dramatic and potentially also problematic democratic practice. So I think that's something that we're brought up in that session. I just wanted to feed that back into this debate.
Yeah, well, I wanted to mention also that, so for instance, in the guidelines for the governance of digital platforms, one of the things that we highlight in a very important manner is that we need to be careful of labeling content because although it's true that there's a lot of systematic disinformation, systematic campaigns of disinformation that can be recognized as subject of restriction, there's specific pieces of content that should be gone through a due process of law. And this is important because if we consider that elections actually is a moment where there's special protections for freedom of expression, because it is also important for society to have a plurality and access to information, to a variety of information, we cannot just go and try to regulate, let's say, a trend or a specific type of content. That's why one of the things that we and I'm glad that I was after Dennis, because he mentioned transparency. And I think that what we need to think as civil society, as international organizations, is that we need to ensure that platforms are accountable about the management of systemic risks that they see and they foresee when it comes to elections. So we saw during this 2024 election that some of the platforms published the risk assessment that they did before the process started, but we don't know, for instance, right now, how they evaluated that measures. How often did they continue doing this assessment? Because risk is not static, risk moves, and it is important that when there's like a process of election, they can move around it. We also don't know if they actually reinforce some measures that they have in, let's say, peaceful times and not election times. We do not know how they manage advertising, political advertising, during non-election times and during election times. So I think there's many different elements on transparency, due diligence, and accountability that we need to start like putting forward and specifically reinforcing during election times that will be key for the next election periods. And in our side and also on our government side, it is very important to, if that governments also and electoral management bodies try to be transparent on what is the type of requirements that they are placing during election time and obviously outside election, but primarily during election time to platforms. What are the type of content that they are requiring to moderate? What is, for instance, the type of requirements that they are placing for the staff members? This different type of things, when it comes to this multi-stakeholder approach, how also government is being transparent about the ads that they are putting forward during electoral times, because it's on both sides. So I think that I will share in the chat the guidelines, but there's these specific elements that I think that are important to move forwards. And there's also a new discussion on those specific measures that should be reinforced during this period, acknowledging that, elections do not start with the electoral process, but it's that whole cycle that need to be revised and updated. And definitely civil society actors should be participating.
Yeah, I just wanted to come in here to just add, and also to follow up on Anna Christina's point on the role of electoral management bodies. I think that's very crucial because in India, speaking from my context, there has been a recognition by the Election Commission on the role played by social media platforms in influencing the discourse. So there has been some guidelines of sorts put up so they now actively also look into the social media activity, and there are some set of guidelines that the candidates or the political parties have to follow. But the problem here again is the implementation. So there have been an instance, no, not one instance, a couple of instances where a major political party had put out hateful and divisive video against a particular community, and that had gone viral, and it took a lot of time for the commission to take down, to ask the platform hadn't taken down, so it took time to for the video itself to be taken down. By that time it must have gone viral. So I think that coordination between the electoral management, they should more actively look out for such instances. They can't just trust the social media platforms to monitor the content. So I think the electoral management body, the regulator's role here is very important. And I mean, they should come up with some comprehensive and concrete SOPs or whatever that's very contextualized to the digital world. So yeah, I just want to highlight the importance of coordination between the electoral bodies, the platforms during the election time. Thank you.
Thank you so much. I have a question of my own, actually, that I wanted to hear from you. Actually, Mary touch upon a bit on this. Should the responsibility of balancing freedom of expression should lie solely with platform providers, or governments and regulatory bodies have a role to play? Which role should be this? And how do you see the stakeholders' role in this debate? Any experiences that of platform regulation that are going well in any countries? The court should have like a permanent role, as it is, for example, here in Brazil, or should we think of regulatory bodies within the government, for example, as it is in Turkey or other countries, to more or United Kingdom as well. So what do you think about these arrangements? Is there like a good model that we should look as on a horizon, or this is not possible yet?
So I would not say that we can just yet say that there's a perfect model. I think that in many of the cases, this is something that we are looking at that is just approved. For instance, in the case of the European Union, the DSA, the Digital Service Act, it's just had the first published of the human rights assessment, that the risk assessment, just like 2 weeks ago or 3 weeks ago, and still researchers are looking at what they find there. The UK Safety Act still also in the process of just published the mechanisms for managing risk. So I think that there's a lot different to see, and for researchers, for civil society to see how this is actually changing the behavior also for the platforms and engaging new actors into the discussion of digital platform governance. Definitely in the Asia Pacific region, Australia has a lot of advances on safety mechanisms that have been put in place. So there's different models that we have seen all over the place. I think regulatory authorities are also changing also their view and their narratives in order to think broadly on systems and processes, which I think is very, very important, because during the 2015 to 2020, we still saw a lot of the solutions as to criminalize content. And now we're going more on the path on trying to identify how the systems and these processes should be, how these platforms should be accountable about the systems and processes that they put in place in order to identify potential harmful content and to deal, et cetera, with these issues. I think, as I said in my last intervention, that these published human rights assessments that the platforms did before elections are a good step forward. That that it is definitely not the only thing that they should do, but I think it is important. And I definitely don't think that it only relies on the platforms. I think that, in order to enable the environment for freedom of expression online, there should be participation of states, and there should be participation of civil society, academics, etc. But specifically from states actors, that, one of the things that was mentioned by Mary was this, how do you ensure that once you're, included in the internet ecosystem, you have the digital tools to engage properly and have control over your own content, over the products and so this everything means, an interaction of different stakeholders that is not only governments and regulators or platforms. So I think there's definitely a duty, I would say, and it was said as well from state, for instance, also to protect journalists, which are then are critical voices that we need to protect also in the digital space. We definitely need investment from the governance system in media development, considering that platforms have already taken most of the advertising models for traditional media. So I think there's many different actions that should be taken by different stakeholders, and it's not just one side of the only one thing that corresponds to one only actor.
Yeah, I also I'm actually wary of giving either the platform or the state the control over how to regulate the speech. But both of them have their, speaking from the Indian laws, I can say that earlier it allowed platforms to platforms were not required to that safe harbor protection, right? As long as they are not overseeing it, they cannot be held liable. And then there was a court order which said that platforms needn't actually moderate, and actually all the speech decisions should come from the court. Any dispute that you have, it has to go to the court, and if the court says that a content has to be removed, it needs to be removed. But then the problem with that is, we know in the context of internet media, going to the court and getting an order, it's really not helpful for a lot of content, especially related to online gender-based violence, where quick removal of content is necessary. So then that leads us to rely on the platforms again. And then there have been, and then we realize that, okay, platforms are not doing the role. So in India, we now currently have a system where if someone is aggrieved of a decision of the platform, then they can go to a government body, which will obviously have government bureaucrats looking into the decision. And there have been concerns about how fair that is going to be. So yeah, I think it's a tricky thing as to who should have the ultimate say. And as Anna Christina says, it should be a collaborative effort. I think, especially, I just want to talk about the Australian e-safety commissioner, where they collaborate with the platforms to actively take down content. So I think the civil society role is also important in really taking down harmful content from the internet. Yeah. Thank you.
Dennis, do you want to add something as well, or should we wrap up? Nope.
If not, I
Yeah,
might
so-
throw in one
Oh,
curveball in
sorry.
the discussion. Have you thought about platforms or platform-like things that are not centralized in a way that they could be controlled by the management? There are some chat tools that are based on onion routing or peer-to-peer communication or whatever, and there is basically no central point where you can choke point or no company behind it that you can give orders to. How would you regulate those? So, what, if anything, can be done about those? Too difficult question, I'm afraid, at this point.
Does anyone want to address this?
Yeah, I mean, I may not have an answer exactly how to regulate them, because even I also feel that, so when we talk about dismantling the centralized structures, we then say, oh, we should have, even in my intervention, I said we should foster the development of alternative communication platforms, which are decentralized. And there have been excellent, like for example, Mastodon is a federated model, and then there have been instances like social co, which runs on a cooperative model. So while this poses an alternative to the current centralized model, there are still challenges there with respect to moderation. So I'm not really sure how to regulate such platforms, but I feel that these should be explored. And they do have their advantages in giving more, in enabling, instead of some centralized team of moderators, it allows the users also to engage in moderation activities. But again, I don't know how much it can be scaled on a larger level where that's accessible to a lot of people, and how to deal with the moderation problem is really is something that I'm also thinking about. I would like to hear if anybody else have a opinion on this.
Just noted that we have 4 minutes to go, and that Fediverse Mastodon type thing is solvable, I think, to an extent that it does offer each Mastodon server is still a server that's controlled by someone. They have their different moderation policies, but some different approaches are much harder to moderate. But anyway, I have spoken enough. I'm not missing. I give Yasmin, carry on whatever you want to say. 3.5 minutes.
Thank you so much, Stephanie. Thank you, Dennis, also for partnering here with the CPR and the IRPC folks as well. Thanks, Anna Christina and Mary Mohammed, for joining us here. Mayra Saad, who had to leave a bit earlier. Thanks, everyone who is watching us online or in person. Apologies again for the technical glitches and etc. See you next year. Please keep up with the CPR and the IRPC activities. We have mailing lists if you want to subscribe to us, and also to engage with our internal activities within the coalition. Please write me or Dennis, depending on each coalition that you want to join. We much appreciate new people coming in. Thank you so much once again. Hope that you enjoyed the session. See you next time. Bye bye.
Dennis, you have 2 minutes if you want to say something else.
Just want to reiterate, thank you so much, everyone, for speakers, moderators, technical team, and Riyadh. And thank you so much for the session. And we'll see you next year at the IGF. Please check out our websites and join the email lists.
So we are finishing in time. More than a minute to go. Perfect. See you in Oslo.
Bye-bye.